Welcome everyone to this program. We are very thrilled and excited to welcome all of you for this Transmasculine Summit. We are also very happy to see all of you here because we were waiting for this day for a long, long time since we started working on our report. I just want to remind you few instruction norms which we had already shared with you over WhatsApp or over email ID that we want to make this space a we will respect each other's identities and try to participate as much as we can in this program so we can also have the ownership on each and every one when we are having conversations, when we are presenting, when we are discussing few things. So please be attentive here. So there are two other instructions that we will be doing photography and live streaming. So if someone don't want to are not comfortable to photograph, please let some of the volunteers or some of the team members know. You all know that who are from OHM team. So please let them know. The another thing is that we are going to do a live streaming, so all the program which will be happening, it will be live streaming. So people who don't want to live stream, they don't want to photograph, they will also not be live stream at this point of time. I once again want to welcome each and everyone. So let's start our program with Lalit team's welcome. So right now I want to invite Lalit team to over a dais and give us a warm welcome with their own unique ways. Thank you so much, Lalit team, for your warm welcome. So, right now we are going to invite Sarvagya, who is our in-house performer, artist, who is going to present a song and a performance for us to welcome us and kickstart our program. So, welcome, Sarvagya.
Hello. आवाज आ रही है? Hello. Start करें. Hello everyone. This is Sarvagya and this is Danny. So we'll be doing the opening act. So can I have a क्यों इस कदर हैरान तू मेहमान तू ओ दुनिया सजी तेरे लिए खुद को जरा पहचान तू प्यास है बारिश का घर भी पास है हो रोके तुझे कोई क्यों भला संग संग तेरे आकाश है मेरे मन ये बता दे तू किस ओर चला है तू, क्या पाया नहीं तूने, क्या ढूंढ रहा है तू। जो है अंश कहीं, जो है अंश में, वो बात क्या है बता। मितवा कहे धड़कने तुझसे क्या, मितवा ये खुद को तो ना तू छुपा। मिट्टी जैसे सपने ये कितना भी पलकों से झाड़ो फिर आ जाते हैं। कितने सारे सपने क्या कहूँ किस तरह से मैंने तोड़े हैं छोड़े हैं यूं। मेरे साथ चले मुझे लेके उड़े ये क्यों। डाल डाल कभी बात बात मेरे साथ साथ फिर दर दर ये कभी सहरा कभी सावन बनू रावण क्यों मर मर ये कभी डाल डाल कभी बात बात कभी दिन है रात कभी दिन दिन है क्या सच है क्या माया है दाता है दाता। बेरंग सी है बड़ी जिंदगी कुछ रंग तो भरूं मैं अपनी तन्हाई के वास्ते अब कुछ तो करूं। जब मिले थोड़ी फुर्सत जब मिले थोड़ी फुर्सत खुद से कर ले मोहब्बत इन दिनों दिल मेरा मुझे तुम्हें है कह रहा तू खाब सजा तू जीने जरा। So, last song would be like sung and played by Danny. Give him a round of applauses.
Caught up in heaven, don't you the same, but never been the same have I. The 7S is always fleeting like a flame, but I'm never one to change, am I? Call it a lesson when I feel you slide away, and I'm missing out on having life. You make me complete. You make me complete. You make me a complete mess. Oh, you make me complete. You make me complete. You make me a complete mess. Ooh.
Thank you so much.
Can we please give a good shout out to them once again? Thank you, Savagya. Thank you, Daniel. Now, I would request our team members to welcome the dignitaries and accompany them on our dais. We welcome Dr. Aden, Principal Researcher, Dr. Chiranjeev Bhattacharya ji, National Program Manager, Health, UNDP India, Abhimanyu Saxena ji, Team Leader, Health System, Strengthening, UNDP India, Dr. David, our estimate, and I also want to request Rajesh Kumar Makkar, Deputy Secretary of Drug and Prevention, Ministry of Social Justice and Empowerment. Uh, Radhika Chakravarti ji had sent some of her regret that she haven't able to join us today, but we have Sri Rajesh Kumar Makkar from their department. Welcome everyone on dais. As one of our organizing partner and one of the strongest ally to the trans community, UNDP's commitment to support the trans community has been unparalleled. So I want to invite Dr. Chiranjeev Bhattacharya ji from UNDP India to address the audience with his welcome note. Dr. Chiranjeev Bhattacharya ji Dr. Chiranjeev Bhattacharya is a medical doctor and public health expert with experience of working for National Public Health Program at district, state and national level, focusing mostly on HIV and immunization programs. Currently, he leads the UNDP India's work on HIV, LGBTQI rights, neglect tropical diseases, and One Health and support the state outreach of immunization project. Dr. Chiranjeev has been instrumental in facilitating yearly LGBTQI health symposium at national level, and we request him to share his welcome address. Thank you, Chiranjeev, for being here with us today.
Thank you so much for this kind and very long introduction. It was not needed actually, but anyway, thanks a lot. Respected dignitaries on the dais, Sri Rajesh Kumar Makkar sir, Deputy Secretary, Ministry of Social Justice and Empowerment, Government of India. Respected David Bridger, Country Director, UNAIDS, uh, dear friend Eden from Dexter University, US, my colleague Abhimanyu Saxena, Team Leader, Health System Strengthening in UNDP India, all key stakeholders who had taken time out and join us here today, and dear friends from the trans men community or trans community who have come here from across the country to be part of this one-day summit. Uh, on behalf of the organization or organizers of this summit, I welcome all of you for taking time out and joining us for this discussion. So before I hand over to the MC, I would just like to share a few thoughts on this event. As you would have known that this event is basically focusing on disseminating the findings of the first national level study on the health issues of trans men in India. So I think as UNDP, we have always believed that we can play the role of an integrator between the community and other stakeholders, including the government partners. So with that in mind, we have we have sort of come up with this advocacy summit, where we not only discuss the result of this national level study, but also uh, deliberate on the action points that will come out of this from this study, and really appreciate the ownership of the Ministry of Social Justice. Madam Radhika could not join, but Rajesh sir is here, and I am sure that the high level intervention or guidance that is needed for policy level decisions for the community will be steerhead by the Ministry of Social Justice. And as the development partners, UNDP, UNAIDS, we are there, and David is also there representing UNAIDS. So we are there to support the ministry for the community. So trans men community, as we all know that among the LGBTQI community or within the trans community, again, trans men have their own unique issues which are less discussed. And I'm sure when Aiden is going to speak about the study findings, he is going to share that how less issues of trans men has been studied. So I think this is a very welcome beginning in this area. Of course, this study might have its own limitation, and I had the opportunity of going through it, yesterday. So it may have focused on a certain group of population, and some group of population may not be part of it because it was done online, etc. And the technicalities they will address. But I think, having said that, this is a very welcome first step, and it will guide us to take the next step. For example, if tomorrow Government of India under Ministry of Social Justice wants to do a national level study on the issues of trans men, we will have a ready-made adapted tool, which can be a ready-made tool, tested tool, which can be adapted and implemented by the government. So I think with these words, I welcome all of you to this one-day event, and we hope that we will have fruitful discussions during the course of the day. Thank you so much.
Thank you, Shivanji. Now, I hope that I can consider this as a safe space and do all the mistake I am doing today. Sorry for all these things. Um, so I want to invite Dr. Aiden. We know that we are gathered here to know what are some of our findings through this research. So we want to invite our own researcher, Dr. Aiden. I will be giving his short intro. Dr. Aiden is an assistant professor in epistemological um, in the Donson School of Public Health at Dexter University in Philadelphia, USA. He has been working in field of transgender health research for over 15 years. I also want to share a small story about how this work has begun. Dr. Eden met Abhina Iyer, a senior translight activist in one of the international symposium, and Abhina invited Eden to India to see and look some of the work happening here. And when he got the opportunity, he came here, he joined here, and he decided to do this study with a transmasculine community. So I want to request him to come here and share brief research findings with us.
Thank you so much, Vihan, for that warm welcome. It's a pleasure to be with you today. Thank you all for coming. Thanks to those who are watching the live stream as well. And I'm speaking on behalf of a large team who I'll acknowledge in a moment, but it's been a real pleasure to finally be able to share this with you. What I'm going to do now is talk a little bit about what Our Health Matters was, and later in the program, I'll come back and share more of the findings in detail. So Our Health Matters is a community-based participatory research study. That means that it was led from the very beginning by trans men and transmasculine people. I was who I first met with on my first trip here back in 2018. So we've been working together now for over 5 years. And it was mixed methods. So we used both qualitative approaches, interviewing people, as well as quantitative approaches, a large national survey, as Dr. Chiranjeev just mentioned. The project was led by a steering committee, most of whom are here, of transmasculine people from across the country in partnership with researchers from India, Canada, and the United States. We began with community consultations that we held in Delhi, Mumbai, and Bengaluru in 2019. We wanted to hear from people in the community about what their priorities were for the research, what they felt was most important for us to study, and how we should do the research. We then got funding from the National Institutes of Health in the US to conduct our study, which we did from 2021 until early 2023. As I mentioned, it's a huge research team. I want to highlight our steering committee, who are listed at the top here, without whom this research would not have been possible. They're the reason that we are all here. I really want to acknowledge them. Also want to acknowledge our other researchers on the team, including Madhu Bhatala from Population Council, who unfortunately could not be here today, but sends his regards to us, as well as Dr. Venkatesan Chakrapani. Venki is here and want to acknowledge his amazing contributions, as well as collaborators from Harvard and the University of Toronto. Also want to acknowledge our peer research investigators who collected data for the study. We hired and trained people from within the community. That was really an important part of this project, as well as our advocacy fellows who made this event today possible, Satvik and Meghna, as well as our staff at Drexel University. A round of applause for all of these amazing people. I'll briefly just talk about what we did in terms of the study. So as I mentioned, we had community consultations in 2019 with about 30 participants. And we have a report from those consultations available on our website, ourhealthmatters.in, where you can learn more. We heard from people that the key issues they wanted us to address were about access to healthcare, the importance of peer support and family support, the need for legal gender recognition processes that work for transmasculine people, so the ability to update documents appropriately, and that they wanted our research to have both an online and an in-person component so that people could be anonymous, so that we could have language accessibility, and so we could build community. And so we took everything that we heard from those consultations into the design of our study. So as I mentioned, we began with qualitative interviews with 40 participants. This was in the middle of the COVID-19 pandemic, so we ended up doing these virtually in Hindi or Marathi. We covered a whole range of topics, again, guided by what we heard in our community consultations. Again, we have reports from that phase available on our website in English, in Hindi, and Marathi, including reports on people's experiences of family support and family rejection, as well as a report on experiences accessing healthcare. And then our survey, which is the main focus today, was conducted between November 2022 and January 2023. It was mostly online, but also available in person with our amazing peer research investigators who were based in Delhi, Mumbai, Bengaluru, and Kolkata. And the survey was available in 5 languages. And for all phases of the research, we compensated our participants for their time and their contributions. And we ended up recruiting. We told our funders we were going to recruit 300 people, and we thought that might be a challenge. We ended up recruiting 377 people in under 3 months, which was really a testament to the strength of community networks. It was all community-driven recruitment, and you can see that we had participants from 22 states and union territories, making this the largest study of transmasculine people and trans men ever conducted in India, as far as we know. As I mentioned, I'll share more about the results later today, but really excited to be able to release this report for you today. Before I close, just do want to acknowledge our funders, Canadian Institutes of Health Research. They funded the community consultations that we started with, and the National Institutes of Health, who funded the our health matters. I also want to acknowledge, of course, our partners, Drexel University, where I work, Population Council, Transmen Collective, and Tweet Foundation, and of course UNDP for making today's event possible. Thank you so much.
थैंक यू एडन। आई ऑल्सो वांट टू लेट ऑल ऑफ अस नो दैट कि हिंदी में जो रिपोर्ट है वो हमने टेबल पे रखा है, तो आप वो भी पढ़ सकते हो, और किसी की हेल्प चाहिए होगी तो कोई भी वॉलंटियर्स को भी आप पूछ सकते हो। थैंक यू एडन फॉर प्रेजेंटिंग ऑल दिस फाइंडिंग्स। या सो now I want to invite our respected guest, Abhimanyu Saxena ji, for sharing their opening remarks, thoughts, and reflection of today's event and its significance. I will give a short intro here. He's a team leader of health system strengthening at UNDP India. He has work experience in area of immunization supply chain from almost 15 years and have worked with state government, central government, and multiple UN agencies. Welcome, Abhimanyu ji. Mr. Abhimanyu is a huge ally for trans community, and this reflect in number of initiatives taken by UNDP India to support trans movement in India. Welcome, Abhimanyu ji.
Thank you so much for not so short bio, but very good morning to all of you, and what a wonderful morning. Uh, First of all, the welcome done by the staff of Hotel Lilith and the two musicians. I mean, usually at this point of time in a day, we are struggling with the laptops, answering to emails, addressing a lot of emails. But such a good start of the day, and as we say in the, it's a good muhurat to start something new. Very good morning to respected Rajesh sir, Deputy Secretary, Ministry of Social Justice, Mr. Dan from UNAIDS, Aiden from Drexel University, and all my colleagues from and the community members. Uh, at the outset, I would like to congratulate our health partners, Tweet Foundation, Pop Council, uh, Transmasculine, Drexel University, and all community members who are involved in this study. I think this study will going to have a lot of policy and programmatic implications moving forward. So we are looking forward for this report, and thank you so much for giving us opportunity to be a part of this great facilitation. UNDP is proud partner for this event, along with our health partners, Tweet Foundation, Pop Council, and Drexel University. Uh, Now, as we talk about leaving no one behind and ensuring equitable access, this is very much part of UNDP's current country development program. And as Dr. Chiranjeev mentioned, we reaffirm our support to this great initiatives when we talk about the one of the first study of its kind on masculine person's health. And as Aiden mentioned, that uh, accessing to healthcare services and ensuring that the approach of the community is inclusive. I think this kind of study will definitely open gateway for the policymakers and to design the state level and national level action plan. Uh, in 2021, UNDP partnered with USAID, UNAID, NACO, Ministry of Health, Ministry of Social Justice to conduct a second national symposium on LGBTQI welfare, wherein the 2 years action plan was led. And recently, in August 2023, we launched a training module in partnership with NIMHANS on the psychological support for the transgenders. Now, overall, the ecosystem is getting more inclusive, and I think by the end of this symposium, this meeting, we will going to have a lot of insights for the policymakers and for the program members. So I congratulate once again to the organizers for the study and looking forward for the study findings. Uh, at the outset, the session by Aiden is really interesting. I mean, just to give you an example, when I read that the honorarium was provided to all through UPI, so I realized, okay, if it is done through UPI, it means they all have bank accounts, and they are connected. They are part of the inclusion. So when we start this initiative, the lens of inclusion is in place. So looking forward for this, and let's work together, and we reaffirm UNDP's support to take this forward and to have a better collaboration. So thank you so much, and best wishes to all of you. Thanks.
Thank you so much, Abhimanyu ji. Um, Now, I want to invite our respected guest, Dr. David Prejer, to share his opening remarks. He is currently the country director of UNAID of India Office, where he leads efforts in promoting and expanding integrated United Nations systems response to HIV in country and providing the strategic direction, advocacy, coordination, and technical support, and connecting leadership from government and communities to deliver the life-saving HIV services. Previously, had been a UN country director of Indonesia and Sri Lanka. Thank you so much, sir, for joining us today. Uh, Once again,
Okay, thank you. I'm not sure I deserve all of those attributes. Anyway, look, thank you and welcome. Let me really acknowledge the presence and the support, and thank you, Deputy Secretary, for the Ministry of Social Justice and Empowerment for being here. And let me really commend the government of India for really embracing change, but also in listening and consulting with the community. Let me also acknowledge the support of the National Institute of Mental Health of the US, also the Canadian Institute of Health and Research, in partnering with the Tweed Foundation, the Transmen's Collective, Drexel University, the Population Council, and my dear colleagues at UNDP. And importantly, what I really wanted to do was thank each and every one of you here today, especially those here and present who shared your lived experience in this research. I'm really honoured to be here today and at the launch and the discussions around the findings from this report, Our Health Matters, India Trans Men and Transmasculine Health Study. I know and appreciate that the results you will be hearing today and reading and discussing later today likely come as no surprise to each and every one of you, as they are your lived reality and they reflect the challenges you face on a daily basis. The report is a stark reminder that your reality, your experiences, are a real cause for concern. The report sets out signposts for areas that require urgent attention, and the data will no doubt shape the future development of policy and improve on access and service provision in a range of areas. It was alarming to see the high levels of discrimination in a range of settings, from health to housing to employment and education, and it was especially alarming to see the levels of violence, from verbal harassment to physical and sexual assault, being reported. These are serious issues and they really deserve serious attention. And I know from my experience, long time ago, as a young gay man trying to access services, especially health services, this only came about when there was trust, when trust was built and in an environment where I didn't feel I was being judged. So, look, today is a really critical step moving forward to getting people to understand the need for such trust and the changes required in order to establish and build that trust. Documenting the barriers, teasing out the issues, and using the data to advocate for change is essential. So just let me congratulate everyone associated with the study here today and offer our solidarity as the UN system and using these results to advocate for further change to strengthen trust, to build a safe environment for everybody. Thanks, everyone.
Thank you so much for your welcoming remarks. Before Rajesh Makkar sir gives his keynote, we can take this moment, which is very much awaited for us. For which we are gathered here, we are collected here to unreveal the report. So I want to request all our dignitaries to unreveal the report, which is present on the table. It will be helpful if you can all stand together for. This report might be look like that it are only some pages which we had wrote for after these 5 years. But there had been a lot of efforts put beyond this. We will be distributing report on your table, so you will also get the copy. We had put lot of efforts to make this report, to make sure that data should not be a bias. It should be accurate and come from with various perspective that data can be used for advocacy. So thank you so much for everyone for being here today. I want to request. Can we please settle down? Thank you so much. Now I want to request Rajesh Makkarji to give his keynote. He is the Deputy Secretary of Drugs Prevention Department, and he is a part of Ministry of Social Justice and Empowerment. Thank you so much, sir, for being here.
Thank you. And good morning, all of you. Thanks for giving me a chance to be present here. Actually, my Joint Secretary, Ms. Radhika Chakravarti, was to be present here, but due to some preoccupation and with some important meetings, she could not make it here, and that's why I am present in front of you. First of all, I congratulate all of you for this study and the fabulous report which has come out. Ministry of Social Justice is always supportive of the issues, concerns, and welfare of transgender community and also for transmasculine community. As you all know, Ministry of Social Justice and Empowerment is the nodal ministry for welfare of TG people. After consistent and numerous efforts, Transgender Persons Protection Rights Act 2019 was enacted by the ministry, and thereafter, transgender rules were notified under the act. There has been significant contribution in the enactment of the act from the community in this regard. To take the rights of the transgender persons, we have developed a national portal to take care of sensitive needs and documentations of transgender people. National Portal is an online portal providing end-to-end solution where transgender people can apply online and get certificates and transgender cards from competent authority. And same can be downloaded from any place. Any place means that transgender people do not have to go to the issuing authority. There is no interface between the issuer and the applicant. Need for any transgender person to go to office of issue and request for certificate has been completely ruled out. There is no need for any transgender people or person to request in person. This has been done to ensure that there is no hesitation on the part of any person to go in person. So they can take the advantage online through the portal. It is true, I saw the report. There is mention that there is some problems are being faced by the applicants. It is true that despite several rounds of trainings provided to district administration officials across the country, there is some delay in issue of these cards and certificates. Ministry has taken a serious note of this delay and strongly taken up with the states for seamless issue of transgender certificates and identity cards. And I hope with this intervention, the chances of delay will come down drastically. Transgender persons' health is another major area of concern for the community and for the ministry as well. That's why ministry has entered into an MOU with National Health Authority and details of package are being worked out. Very shortly, this intervention will reach its finality, and I assure you that you will all be able to avail the medical facilities through this system. The ministry, while taking necessary action for welfare of transgender persons, including shelter, medical requirements, etc., is also focusing on transmasculine persons requirement, whether it is health or overall well-being. I am very happy to be here to represent Ministry of Social Justice and Empowerment, where the health issues of transmasculine persons are discussed in length. We congratulate all UN bodies representatives present here for support to transgenders issues. And in coming days, we are hopeful that several well-being measures for the transgender community and masculine community would be rolled out by the ministry. I thank representatives of the community who are present here and wish them best for their future. Thank you.
Thank you so much, sir, for your keynote. Now I want to invite Shaman to facilitate Gates and also to express our gratitude towards Gates because some of delegates might be leaving soon due to their busy schedule. Welcome, Shaman.
Thank you, everyone, for the wonderful inaugural of the report. Like Vihan said, it's been 5 years, and this is the kind of report revealing we imagined, where we had the people who care about us around us, we had the people from the community, and show the solidarity that we are here with you, and we are seeing through, all of these activities that need to be done. Um, Thank you, all the guests, for your key remarks. All of them show us that there's a lot of hope, there's a lot of action that's happening. Some of us, like, who are in our cities and districts, a lot of times struggling and, feeling hopeless that I don't know when the change is coming. But it's important to gather here and see that yes, there's supporters and allies who are looking into what our experiences are, listening to us, and hence making decisions on the policy tables. So I'd like to invite my team members to felicitate the guests here. I'll request Mr. Aryan Pasha, member, National Council for Trans Persons, to come on the stage and felicitate our guest of honor, Rajesh Makkarji, Deputy Secretary, MOSJE. MOSJ has been a constant support, and we know that the efforts are being taken at the policy level to ensure an inclusion in the healthcare system and other facilities. Thank you, Mr. Rajesh, for being here today. I also request Aryan to felicitate Dr. David. Again, a huge supporter of the trans community, how he shows up every time we call him, always a phone call away, and always pushing for the changes. Thank you, Dr. David, for being here. I request Raj, a senior trans man activist, to come and felicitate Abhimanyu ji on the behalf of the team. This event would not have been possible without your support. It's been an honor to have you, sir. I request Satvik to come on stage and felicitate Dr. Chiranjeev. Dr. Chiranjeev has been one of our most trusted partners, just a call away, always for the community, and we are truly blessed to have you, sir. And because I have troubled you the most, Aiden, I'll take the honor of felicitating you. And thank you for having the patience for these last 5 years, helping us bring alive this stream today. And on behalf of the whole transmasculine community in India, we wholeheartedly welcome you and thank you for your efforts for the last 5 years. So before we go on a tea break and also take a quick group photo, because there are dignitaries who may not be able to stay till the end and we really all want to take pictures with them. I just want to have a small list of people to thank, because vote of thanks are usually done in the end, but I feel it's important to do it at the prime of the event, because these are the people who made it happen. I first and foremost thank the entire team of UNDP India for supporting this event. I want to thank APTN, Asia Pacific Trans Network, for supporting communication materials for this event. I would like to thank the entire team of Lalit Hotel for always making this the most inclusive place and the most safe we can feel anywhere. I'd like to thank Vihan V for his continuous efforts in putting a great show today and for all the humble attitude he has been showing. I'd like to thank Sastik Creations team, our event management partner for today, for all the setup that they have provided today. Our entire research team who are not here today, all the ones who are sitting in the US and Aiden's team for making this event possible. I'd also like to thank Sarvagya and Danny for an amazing performance today. Satvik and Meghna for their efforts on making this event happen. And last but not the least, the team of Tweet Foundation, who keeps working behind the scenes all the time and make all these events possible. And to all of you, to all the guests here today, the doctors who have shown up today, the parents who have shown up today, the media persons, all our allies and supporters and the community members. There's a long way to go, but this is what will make it happen. So thanks to all of you. I'd request all of you to come for a short photograph to the front of the stage, and then we'll break for a tea break. And we have excited stuff planned up for you in the post the tea. There's community members who will be sharing their experiences and having very important discussions on the report. So one quick photo, please.
आगे बैठ जाओ, कोई तो एडजस्ट कर लेते हैं। हाँ, लग जाएगा। और कोई बचा है क्या? हम सारे फ्रेम में आ रहे हैं? आपसे नहीं पूछा था मैंने। हम सब फ्रेम में आ रहे हैं? ओके, हम सब फ्रेम में आ रहे हैं? ओके, एवरीबॉडी रेडी? से ट्वीट अगेन, ट्वीट वन मोर पिक्चर। ओके, थैंक यू, थैंक यू।
We'll take a 10 minutes tea break and we'll be back again to continue the program. Hello, everyone. Can we start settling in 5 minutes? Yeah. I'll repeat myself. Can we start settling in 5 minutes? We'll start with the rest of the sessions today. Hello, everyone. Please, can we start settling in 5 minutes? सुनाई नहीं दे रहा है. hello. Requesting everybody to please come back to your
finding. We know that Aiden had talked a little bit around process and how we started to work on that report. But now with more community members and with some of our ally, Aiden will discuss more in detail that what are some of the findings are of research. Welcome, Aiden.
Thank you. So we know that you have a 44-page report in front of you, and you probably have not read the entire thing since it was put in front of you. So we wanted to give you a little bit of a tease of what's in the report so that it sets the context for the conversation that the panel is going to have in a few moments. I should also mention something I forgot to say earlier, is that this report you have in front of you is in English. There is a Hindi version that simply due to timing issues is not here today, but it will be on our website in the next 2 weeks, so please keep a lookout for that. There is also a Hindi version of these slides. So if you don't have that's available digitally, we can send it to you in WhatsApp. If you don't have a copy of it but you want it, please let me or Shaman or one of our team members know, and we'll make sure that you get a copy of those slides in Hindi. Oh yeah, well, there's printed copies too. So if you want a copy of the slides in Hindi, if you wave your hand around, we have them right up here. So as I mentioned previously, we conducted a survey with almost 400 participants, and we addressed a wide range of issues, including demographic characteristics, people's experiences of stigma and discrimination, their access to government schemes and to changing their identity documents, their level of support they received from the community, their mental health, and their access to healthcare. And I'll just highlight a few of the key results. And as I do so, I also want to acknowledge the people who contributed these data, the 377 participants, some of whom I imagine might be in the room. So thank you to those of you who contributed your experiences and shared them with us. So our participants were relatively young overall. So about half were between 18 and 24. And we see this globally in research with transmasculine people, that the community that's growing increasingly visible and more young people feel empowered to come out and live as their authentic selves. And it also really speaks to the need to provide support to people because of the vulnerabilities that particularly youth can face navigating lives as trans people. And also speaks to the need to make sure that we do reach out and engage older people as well, who might be less connected to some of the community networks where we recruited people. One thing I really want to highlight, and I'm really glad that a few speakers earlier mentioned the fact that most of the participants participated online. And that, of course, means a more economically privileged group of people than was able to participate. So one thing I should mention is that we did have in-person data collection in 4 areas of the country, and people who participated in person could be paid in cash. So it was possible to participate in that way, but definitely we have a very highly educated sample. You can see that over half had a university degree or a diploma. One thing I should also mention is that we have the survey in 5 languages. You'll see in the report that about 70% of people did submit the survey in English and the rest in Hindi, Marathi, Bengali, or Telugu. And so definitely a group of people who are more economically privileged than the population at large. And yet, even so, when we think about something as basic as food security, did you have enough food to eat in the last year, or did you have access to the kinds of food you wanted to eat? Most of our participants did not have basic food security. So even though they might have educational privilege, people had pretty low incomes and struggled with financial security. One thing that was highlighted earlier in terms of was the processes have been put in place to try to improve access to to updated identity documents for trans people. And those steps are really important. Yet we found that there still remain really critical barriers to being able to change identity documents. So we asked people, have you changed the gender on your identity documents? And over half of participants said, no, I haven't been able to yet, but I want to. And so this speaks to some of the ongoing barriers that might exist. And for people who had tried to change their identity documents, 91% of people said they had at least one negative experience going through that process. Most often that they had to educate officials about transgender issues when they were trying to get their documents changed. So I was really heartened to hear that the Ministry of Social Justice and Empowerment is going to take up this issue and is looking at training and ensuring that those issues do not happen. Earlier, our colleague from UNAIDS, David Bridger, mentioned how common it was for people to experience discrimination. And this just shows just a sample of some of the data around the kinds of discrimination that participants faced. So for example, almost 3/4 of participants said that they struggled to find bathrooms to use. Almost half said they had trouble finding or keeping housing because of their gender identity. And about half said they had trouble finding or keeping employment because of their gender. I could talk a lot about discrimination, and there's a lot of information about discrimination in the report, but I also really want to highlight the strengths and resilience of the community, which really come through in the data as well, and that Shaman and Aditya just spoke to so beautifully. So despite all the discrimination and stigma people face, almost 80% of people said they were proud to be a trans person. People said they were comfortable revealing that they're trans to others, that they feel part of a trans community and feel connected to other trans people. And so really thinking about how we can leverage these strengths moving forward to address the challenges that the community faces is so important. One of the things we focused on was experiences of support from family members. That was something that we heard from our qualitative interviews that was really important for people's well-being. And thank you to the family members who are here and who are supportive. Unfortunately, we found that only 30% of participants said that if they had a mother, that their mother was very supportive of their gender. And only 25% said that their father was very supportive. Thankfully, if people had a partner, most people said that their partner was very supportive, so that was 75%. But overall, a lot of work to do around building family support, which is so important, particularly when we think about how many of our participants were young people. For people who did have parental support, what did that look like? It could included things like being accepting of gender presentation, like their clothing and their hairstyle, giving emotional or financial support for gender transition, educating themselves about transgender people, using the correct pronouns. We asked a lot of questions also about community support, and not surprisingly, because we recruited people through community networks, most of our participants were connected to trans or non-binary people, particularly online. But less than a third were connected to other trans or non-binary people in person. And almost 60% said they were interested in having access to in-person support for transmasculine people. And I think that's something that we can be doing more about all over the country to ensure people are able to connect with others who share their experience. One of the main things we focused on in the study was mental health, and Shaman just really movingly spoke about people in the community who have been lost because of mental health struggles that are related to stigma and discrimination and violence. And one of the really stark findings we did find is that so many of our participants were struggling with mental health, including depression symptoms, anxiety symptoms, and consideration and attempts of suicide. One thing that's also in the report that I really want to highlight, though, is that this risk was not uniform, which means it's not inevitable. So we found that people who were employed, people who had parental support, and people who had been able to access transition-related healthcare were less likely to report depression symptoms, anxiety symptoms, and consideration of suicide. And so that points to some of the things we might be able to do to improve mental health in the community. We also found that almost half of participants said that they had a need for mental health care in the past year that was not met. Again, speaks to the need to increase mental health services. And to avoid mental health, quote unquote, mental health services that are actually damaging. So 1 in 4 participants said they had experienced conversion therapy, which is an unethical and ineffective practice that attempts to change someone's gender identity. In terms of healthcare overall, we found that almost a third of participants had avoided healthcare in the past year because they feared being mistreated. Promisingly, if people did have a regular doctor, only about half of participants had a regular doctor, but if they did, about half of them said that they were comfortable discussing trans issues with that doctor. Of course, that means half of them were not, and so it speaks to the need for more education and support in medical curriculum for trans health, and particularly for transmasculine health issues. In terms of transition-related healthcare, and that can include any combination of hormones and surgeries that people might need, and not all people need them, but most of our participants did. So you can see that 6% said they weren't planning to receive hormones or surgery, and 5% weren't sure, but the rest needed that kind of healthcare. And about a third of participants said that they were planning to receive transition-related healthcare, but they had not begun yet. And so again, thinking about what are the barriers there that we can be addressing, one of which we know is cost, and one of which is access to qualified and sensitive providers. One of the big areas where we saw unmet need was specifically for surgery. So just to give one example of the data we have on surgery, almost 70% of participants said that they wanted to have chest surgery or top surgery, as it's called in the community, but they hadn't been able to yet. Really speaking again to issues of cost and access. So we make a whole number of recommendations in the report to address some of these issues. I'm not going to read these out for the sake of time, but they include recommendations to improve access to identity documents, both identity documents that recognize that as transgender people, but also identity documents that recognize people as men if that's how they want to be recognized, regardless of medical intervention. And training to ensure that the process is smoother when people try to update their documents. Make a number of recommendations as well around mental health supports, including critically free or low-cost counseling. There are a lot of great private therapists working with the community, but that is out of reach for most of our participants. As well as peer support services, building on the strengths that already exist in the community, and trying to embed some of those services within trans organizations that already have built up trust. Another key aspect, of course, is around family support. So thinking about getting resources and information to families, and critically doing that in multiple languages so that it's accessible to families who need the information. And then, of course, we also make recommendations around improving access to gender affirmative healthcare. And this builds on some of the things that are already happening. So just a few weeks ago, an outpatient clinic for trans people was opened in Delhi, which is so exciting. And we need more of that across the country so people are able to access hormone therapy and other kinds of care in a safe environment. It's also important that that care is covered under state and private health insurance plans. And I already mentioned the issues around medical education and training. I'll leave it there in terms of recommendations because our panel will do a great job in illustrating these issues further. I'll just briefly mention some of what's coming next from our study so you can keep your eyes peeled for it. I already mentioned that the report will be available in Hindi on our website shortly. We'll also publish a brief summary of the report in Marathi, Telugu, and Bengali, so keep your eye out for that. Shaman mentioned that the Asia Pacific Transgender Network has generously helped us to further our dissemination They're here taking video today. They're going to be making infographics. Those will also be available on our website and on their website. We also will be publishing typical scientific journal articles. We started with this report because this is a community-based study and our priority is to return results to the community. But we will also publish traditional scientific articles to ensure that this research gets out to health professionals, to the research community in India and internationally. And again, check out our website because everything will be posted there. Leave it there. Just once again, thank you to our partners and our funders, and looking forward to the panel discussion to follow. Thank you.
Thank you so much, Aidan, for presenting a detailed findings of the report. Now we are going to have a panel on health rights of transmasculine person. So I want to invite some of the people on stage. Firstly, I want to invite Man Chavan. I will also give his brief intro. Man will be moderating this panel today. Man Chavan has an MBA in human resource and has been working of 14 years working experience in global diversity recruitment. He is running his own NGO called Telms Charity Foundation that assists transgender community in India. Man has funded several trans community members for their surgeries and continue to fight with corporates and insurance companies to ensure that trans affirmative surgeries are given as a healthcare provisions. I will also invite Nikunj Jain. Nikunj is a trans man who belongs from small village Suvargia of Madhya Pradesh. He has been working with trans masculine community, particularly in Madhya Pradesh, for 3 years now. He has been fellow at Dignity Fellowship and Trans Leadership Fellowship. He is the founder of Tapish Foundation. Welcome, Nikunj. I also want to invite Kiran Nayak. Dr. Kiran Nayak is the founder of Karnataka Vikalanka Sangatan, an organization working with persons with disability since 2014, and Star Organization General Secretary. His activism on ground has been a very remarkable for all of us. Welcome, Kiran. Now I want to invite Gautam. Gautam is a transmasculine person and young community activist, organizer, and mobilizer. Being a passionate advocate of queer trans community, working equitable healthcare, access to sexual and reproductive health rights and justice in India. Gautam is also co-chair of Tweet Foundation. Welcome, Gautam. Now I want to invite Dr. Aska Sheikh. Dr. Aska Sheikh is an out and proud trans woman. She is one of the India's first transgender doctor. She is an associate professor of community medicine at Humboldt Institute of Medical Science and Researches in Delhi. Welcome, Aska. Now I want to invite Mona Jugran. Mona Jugran is a full-time homemaker, mother, and gardener who is a strong advocate of compassionate living and diversities. She is here today as an out and proud parent from Swikar, the Rainbow Parents, a support group of parents which are proud of their queer children. Welcome, Mona. Now I will hand over to Man to moderate this session.
Okay. Good afternoon, everyone. So let's take a moment here because we're trying to create something which has been not done or addressed before. So where is all the good afternoon? I just said good afternoon. Can I have some energy here, please? That's all? That's all y'all have. So anyways, I want to request somebody, all of y'all that are live and people from the community here to lift this up. Can you please lift this up? You know what this is? This is the time where we did not have a voice. This is the report which has been created for us by Aiden and his team. right? So I want you all to say one thing loud so it reaches out to the lobby. Put your hands up. Where is the energy? Come on, guys. I want you to say at the count of three, trans life matters. Okay? Are we there? One, two, three. Trans lives matters. Come on, energy, guys. One more time. Trans lives matters. I don't think it's reaching the lobby. Please, it should reach the lobby. Trans lives matters. Great, thank you so much. And I would request some undivided attention because we have this amazing panelist here who are going to share some information which is needed, not just now, but also to have a better health and human rights for transmasculine, transgender, and overall this is something that you should not miss out. This is the movement for us. This has been done for us. So it's time for we to honor with undivided attention towards the panelists. Okay. So I hope, thank you once again. Thank you everyone for joining in today. Thank you for the panelists. We have, as discussed, there was an introduction given by the most cutest MC I have ever seen, Vihan. Okay, so one round of applause to Vihan, please, because he has been doing a great job throughout. The cutest MC on the floor. Okay, so let's begin with the panel discussion. We will cover up some of the topics, but Aiden really took us through the presentation right now, which gave us a detail. But we are going to have a live understanding of what are the challenges and definitely what will be the implementation, what are the suggestions that we shall receive from the panelists from here. Okay, so once again, thank you. Thank you for joining in. Okay, so to begin with, first, let me introduce. Okay, I'm a trans man too. Okay, so that is why. Okay, I have got some respect here. So Shaman has asked me to have a seat. Okay, so just a minute. Okay, great. So we are going to first have Mona ji. Okay, so a question put out to you. So this panel discussion is purely based on the study that was derived. Okay, over the past 5 years. So we have been struggling for ever to have somebody to talk to us for 5 minutes. So imagine the kind of work that has been put for us in order to understand what are the challenges we have been facing now. So Monaji let me just give an introduction because I have understood a little bit of her. So she's a mother for a trans masculine child. So she's one of the panelists here who is going to share, where I'm going to ask her questions of what are the challenges she faces and how is that we can have more and better family support coming our way for the acceptance of a trans masculine child, right? So over to you, Monaji. So my question here is, since you are a parent and there must be some kind of challenges you already accepted, you're associated with Swika Rainbow Parents, right? And although that's there, everything is in place. As trans masculine, we have seen the reports does say that there is still a considerable number of kids who have not been able to receive that acceptance from their family, especially their parents. And what would be your advice in regards to the same, that how can a transparent, okay, somebody who is dealing with a trans masculine, or this goes around for all transgenders, binary, non-binary, that how can we have a better understanding, how can parents have a better understanding, what can be done here and forward? Over to you.
Um, I think the first thing for parents is that when a child comes out to them, is to kind of take a beat, take a breath, maybe take a step back, uh, because it's it's the first thing that parent would react, and without realizing that, that is something that can be very damaging, because the very fact that a child comes out is it goes to show that the child has placed a lot of trust in the parent and in sharing something so difficult with the parents. And the child is at that point feeling very afraid, possibly confused, afraid. And all they need is, to hear from the parents that we love you and we're here for you. But yes, as human beings, parents, can, react instead of responding. So that's why I said just take a step back and basically just tap into that unconditional love that, we all parents have in our heart for our children. And just the first thing to do is to support the child and say, okay, I'm here for you and I love you. The first thing is I love you, and no matter what. And to ensure this is my experience. And first, to ensure that the child has support. After we have reassured the child that we are there for them and we love them and we will do anything that is required to, to help them. So basically, to listen to the child and to try and understand what they're going through. At the same time, looking for ways or figuring out ways to support the child if the child needs, support in terms of counseling and other things. And once that is done, then I think parents need to just buckle up and get cracking at educating themselves, reading, talking to people, talking to, to parents of other, trans children or LGBTQ children. Yeah, talking to other rainbow parents. And a lot of times we find that, children are the best ones to, direct us towards, resources which are available online. And so do that. And at the same time, parents have to just be listening to the children instead of please avoid advising, and just listen, and also reading, and like I said, everything connected with people. And it is very important for parents to find a support group or to find some support for themselves. I mean, I was very lucky. Right at the start of my journey um, as a rainbow parent, I met Dr. Sharma, who's here, at a conference on neurodiversity, and I just talked to him very briefly, and that very evening he had connected me to Svikar, and to Ati came, and it was like, we are here, I'm here to support you or to help you in any way. And I can understand now how valuable that has been for me, that support. Because for all parents, it's a long journey. Along with the child, it's the parent's own journey. And oftentimes the road can be bumpy and you hit a bumpy patch. So it's very important to have a support base, or like I am part of Svikar Rainbow Parents, and that has really helped me tremendously. I mean, it has kept me grounded, motivated, and feeling safe.
Yeah, that's true.
Right?
I think when जब हम okay, so I'm gonna also speak out in Hindi here, ठीक है? तो निस्वार्थ प्यार, right?
Yes.
Unconditional love has been something that every child deserves to have, irrespective of their gender, right? और यहाँ पे हमें बिकॉज ये जो हमारा स्ट्रीमिंग है अभी फिलहाल लाइव भी चल रहा है, तो जो भी पेरेंट्स यहाँ पे सुन रहे हैं, अगर आप निस्वार्थ प्यार और उसी को लेके साथ में चले, राइट? और अगर आपको जहाँ लग रहा है कि आपको मदद की ज़रूरत है, तो जैसे डॉक्टर संजय शर्मा है जो अथी चला रहे हैं, या स्वीकार रेनबो पेरेंट्स है, आप प्लीज़ वहाँ पे इन्फॉर्मेशन, नॉलेज सीख कीजिए। बिकॉज़ right resources, right knowledge of how to be a part of your kids ट्रांजिशन हो या भले वो ट्रांजिशन ना करे, पर उनके इमोशंस को समझने के लिए जो चीजें लगती है, जो सपोर्ट लगते हैं, दिस आर द पेरेंट्स हु आर विलिंग टू सपोर्ट यू ऑल। सो प्लीज, अगर आप इन ऑर्गेनाइजेशंस अभी अवेलेबल है जहाँ पे आप रीच आउट कर सकते हैं, जहाँ पे आप मदद सीख कर सकते हैं, so thank you so much, Monaji, because I know it's an emotional thing to open up in front of people, especially to talk about your child. But I am glad that we have so much support. जो 10 साल पहले शायद हमारे पेरेंट्स के पास नहीं था, लाइक मेरे पेरेंट्स के पास तो नहीं था, पर आज ये अवेलेबल है. So please, parents, don't just go in a shell. आप खुद एक डिप्रेशन में मत जाइए या चीजों को अलग तरीके से ना समझ के, राइट? आप हेल्प सीख कीजिए, राइट इन्फॉर्मेशन सीख कीजिए, राइट? सो थैंक यू सो मच, मोना जी, फॉर ओपनिंग अप विद अस. एंड माय नेक्स्ट क्वेश्चन इज टू किरण. ठीक है? Okay, so great. So Kiran is here. Okay, he's a trans man. At the same time, he's also going through some disabilities, right? एंड किरण, हम जानना चाहते हैं आपसे कि मेडिकल हेल्थ, ओके, फिर वो चाहे सर्जरीज हो या हार्मोन रिप्लेसमेंट थेरेपीज हो, हमें पता है कि हमारे रिपोर्ट में से हमने ये डेटा रियलाइज किया है कि पॉलिसीज काफी बने हैं इन चीजों को एक्सेसिबल करने के लिए, पर वो कुछ हद तक किसी को मिल नहीं रहे. इन सिंपल वर्ड्स, आई एम गोना टॉक सिंपल हिंदी जो सबको समझ आए, ठीक है? सो आपकी क्या सोच है? आपने भी कुछ चैलेंजेस फेस किए होंगे इस दौरान. सो आपकी क्या सोच है कि हमने क्या यहाँ पे करना चाहिए और हम कहाँ, वेयर आर वी लैकिंग, वेयर आर द पॉलिसीज लैकिंग, व्हाई आर दे नॉट एक्सेसिबल? अगर आप उसके बारे में हमें आपके एक्सपीरियंस थ्रू कुछ शेयर कर सकते हैं.
Thank you so much, and thank you so much, Helden and TIT Foundation team giving this opportunity. I am part of the survey member, so I'm really happy to hear. तो मेडिकल सिस्टम में ट्रांसमैन को अभी इंडिया में अच्छा सिस्टम नहीं है. सो पॉलिसी है, दूसरा दूसरा स्टेट में पॉलिसी है. पॉलिसी में अंदर एलजीबीटीक्यूआई का एक बड़ा क्वेश्चन है. सो स्पेशली ट्रांसमैन को लोग को क्या चाहिए? सो ट्रांसमैन का भी ये मैं देखा ये सर्वे में, मैं सर्वे करने टाइम में ज्यादा लोग ट्रांसमैन 18 to 25 इयर्स का लोग अभी जल्दी बाहर आ रहे हैं. सो जल्दी बाहर आके हम वो लाइक कर रहे हैं तो एचआरटी चाहिए, टॉप सर्जरी चाहिए, और जल्दी जल्दी हमको हाँ, हम बड़ा होने के क्या क्या चाहिए, ऐसा चीज चल रहे हैं अभी इंडिया में. सो ये अभी एक ट्रांसमैन बाहर आने के एक घर में एक प्रॉब्लम हो सकता है. घर छोड़ के बाहर आए तो अभी शेल्टर का वगैरह वगैरह प्रॉब्लम चल रहा है. स्पेशली हेल्थ का क्या एज में हम क्या लेना पड़ेगा, एचआरटी क्या एज में लेना पड़ेगा, और हम हार्मोन इंजेक्शन के साथ में टॉप ऑपरेशन अभी चल रहे हैं इंडिया में. ज्यादा लोग बोल रहे हैं तो ये तुम्हारा टॉप सर्जरी हुआ है, मेरा टॉप सर्जरी है, तुम्हारा टॉप सर्जरी हुआ है, मेरा टॉप. ये क्या है? कौन बोल रहे हैं? तुम टॉप सर्जरी कर रहे हैं तो तुम ट्रांसमैन है? कौन बोले है? सो ये बड़ा चैलेंजिंग है. रूरल अर्बन पे थोड़ा ये समझ हो सकता है, बट विलेज पीपल ट्रांसमैन को अभी मेरा टॉप सर्जरी है तो मैं ट्रांसमैन है, ये कौन बोल रहे हैं? हमारा बॉडी के साथ डॉक्टर ये क्या बोल सकता है, प्रैक्टिस कर रहे हैं, एक्सपेरिमेंट कर रहे हैं। सुनो, अर्जेंट नहीं है, ये अपना लाइफ है। ये एक सवाल चल रहे हैं ट्रांसमैन को हेल्थ के बारे में। सेम टाइम एचआरटी लिया, बट टॉप ऑपरेशन नहीं किया। तो भी मन को क्या बोल सकता है, बीट से पूरा है। ये इमरजेंसी हेल्थ में एक्सीडेंट हो सकता है, किडनी प्रॉब्लम हो सकता है, हार्ट का प्रॉब्लम हो सकता है। अभी मैं दिल्ली से आ रहे, इधर से इमरजेंसी एक्सीडेंट हो गया, मन को इमरजेंसी वार्ड में है। अब कौन है, मेरा चेस्ट पूरा ऐसा है, बट किधर है हमारा स्पेस, किधर है हेल्थ के बारे में कौन समझ दे रहे हैं। जनरल हेल्थ के बारे में हम बात कर रहे हैं। देन सेम टाइम ट्रांस मैन को नॉट ए एचआरटी इम्पोर्टेंट, नॉट ए टॉप सर्जरी इम्पोर्टेंट, इम्पोर्टेंट है। अब अपना खुद में पैसा है तो हम कर सकता है, हमको हमारा पार्टनर के लाइफ दे रहे हैं तो हम कर सकता है। डॉक्टर एंड ए पॉलिसी के ट्रांसप्लांट के 3 चैलेंजिंग है, मैं देखिए अभी। सो मेरा लाइफ में मन को 35 ईयर्स है। 2019 में मैं टॉप सर्जरी किया। टॉप सर्जरी क्यों किया? जस्ट कंफर्टेबल टू माय बॉडी एंड ड्रेस कोड, ओनली वन। मैं मेरा पार्टनर के वो बोलिया तो मैं टॉप सर्जरी नहीं किया। मैं अभी बराबर बोल रही हूँ, मन को बॉटम सर्जरी नहीं चाहिए। तो मेरा हेल्थ इम्पोर्टेंट है। जल्दी जल्दी ऐसा ये करे। ये रिपोर्ट में ज्यादा हेल्थ बारे में अभी मर सकता है। मैं डिप्रेशन में हूँ, मेरा पार्टनर छोड़ दिया, घर के बाहर है मैं। सो वो सर्वे करने टाइम में ये स्क्रीन कमेटी के टीम हमको मैं डिप्रेशन जा रहे हैं, इतना स्ट्रांग हूँ, ये क्या रहे आज मर सकता है, ऐसा फोन आ रहा है, आज सुसाइड में हूँ। फिर नेक्स्ट डे बात करने चल के काउंसलिंग के, और कौन सा स्टेट में चल रहे तो वो स्टेट में उधर कौन है, आप प्रोफेशनल काउंसलर रहते वो को लिंक दिया। सो ये है हेल्थ के बारे में, इज इमरजेंसी टेंशन ले रहे हैं एक हमारा कम्युनिटी। सेकंड वन इज गवर्नमेंट। सो गवर्नमेंट के अभी स्टेट गवर्नमेंट एक एक है। फॉर एग्जांपल आंध्र प्रदेश में जीवो नंबर 20 है ट्रांसजेंडर को। तेलंगाना में वेलफेयर बोर्ड है। सी देखो इधर, अभी ओडिशा में वेलफेयर बोर्ड है, बट जीवो नहीं है। जीवो इज द इम्पोर्टेंट इन द स्टेट गवर्नमेंट, बजट बनाने के दूसरा दूसरा लोग के इम्पोर्टेंट है। सो ये दो कर्नाटका में जियो नंबर है, 2013-14 में आए, बट स्टेट बोर्ड नहीं है। तो क्या हो रहे तो उड़ीसा में बोर्ड नहीं है, जियो है। दीपक, रूपक, रूपक किधर है? बोर्ड है, जियो है, जियो। तो एक स्टेट में एक है, दूसरा नहीं है। सो ट्रांसमैन को प्रैक्टिकल हमको क्या चाहिए तो वो बोर्ड में अंदर नहीं है। फॉर तेलंगाना में, फॉर एग्जांपल तेलंगाना ट्रांसजेंडर लेवल पोर्ट 2022 अगस्त में बना है, बट जियो नहीं है, पेंशन नहीं मिल रहे, एजुकेशन नहीं मिल रहे, हेल्थ का सिस्टम नहीं मिल, हेल्थ का सपोर्ट नहीं मिल रहे। सो इन आंध्र प्रदेश जियो नंबर 20 सेम टाइम 3000 रुपीज पेंशन मिल रहे हैं, बट बजट नहीं मिल रहे हैं। सो डिफरेंट है, एक नहीं है। सो कितना लोग ट्रांसमैन ये वेलफेयर बोर्ड कमेटी में अंदर है? क्यों बात कर रहे हैं? मतलब हमारा टॉप सर्जरी का हमारा पास पैसा नहीं है अभी। ज्यादा लोग तो रिक्वेस्ट कर रहे हैं, हमारा हेल्थ जनरल हेल्थ का हम किधर जाना पड़ेगा? अभी जनरल हेल्थ इंश्योरेंस है हमारे पास। हेल्थ इंश्योरेंस का कौन सा हेल्थ इंश्योरेंस दे रहे हैं? हेल्थ इंश्योरेंस के अंदर के ट्रांसप्लांट को कितना सपोर्ट मिल रहा है? सो ये एक चीज पूरा ये अभी ये मैं जस्ट इन 2016-17 से बिफोर कोविड ट्रांसमैन इज डिफरेंट, आफ्टर कोविड ट्रांसमैन इज डिफरेंट, ज्यादा है डिप्रेशन में जा रहे हैं।
यस, थैंक यू किरण, बिकॉज आपने जो कहा है वो बहुत सही से कहा है कि काफी जगहों पे स्टेट्स में आज की तारीख में एक्सेसिबिलिटी टू हेल्थ केयर में कुछ चीजें अवेलेबल ही नहीं है। तो अगर मुझे कल जाके किसी से, गवर्नमेंट से या पॉलिसीज से, और यहाँ तक कि हमारे ट्रांसमैन कम्युनिटी है या ट्रांसजेंडर कम्युनिटी है, एक हद तो ये भी है कि हम कुछ टर्म्स या अवेबिलिटी जानते तक नहीं, राइट? मतलब जैसे अगर आपने जितना नॉलेज शेयर किया, आई एम श्योर कि यहाँ पे कुछ लोग हो गए जो यो और ये सारे शब्द पहली बार सुन रहे हैं, है ना? तो वहाँ पे भी हमने देखा है कि एजुकेशन वाइज, नॉलेज वाइज भी कहीं न कहीं ये सारी चीज़ें बहुत पब्लिकली जो होनी चाहिए पॉलिसीज़ को लेके, ताकि ज़्यादा अवेयरनेस हो, ज़्यादा ट्रांसमैस्कुलिन लोगों को पता चले कि अगर उन्हें कोई हेल्थ कंसर्न है तो वो कहाँ जाए? म्युनिसिपैलिटी हॉस्पिटल जाए, प्राइवेट हॉस्पिटल जाए, कहाँ पे सेंसिटाइजेशन हुआ है, जहाँ पे वो सेफ फील कर सकते हैं, ये सारा डेटा और ये सारे इन्फॉर्मेशंस भी आज के तारीख में ट्रांस मैस्कुलिन लाइक ग्राउंड लेवल पे, ग्रास रूट लेवल पे हमें नहीं पता है, सबको नहीं पता है, राइट? तो काफी चेंजेस और सुधारना अभी भी बाकी है। माय नेक्स्ट क्वेश्चन कैरिंग फॉरवर्ड द सेम, ओके, अगर आप इसके बारे में थोड़ा और हमें जानकारी देना चाहते, मोर देन हैप्पी, बट बिकॉज हमने ये चीज सर्जरी और हार्मोन्स, एक बंदा जो ट्रांजिशन लेके आगे बढ़ना चाहे, कंपल्सरी नहीं है ये चीज, प्लीज अंडरस्टैंड। अ ट्रांसजेंडर पर्सन, अ ट्रांस मैस्कुलिन, irrespective of wanting to go for a medical transition or not, is still a trans masculine, ये चीज तो है, राइट? ये चीज हम अभी भी कोशिश कर रहे हैं कि हम एक क्लियर रखें, कम्युनिटी को ये बात समझा सके, बट एट द सेम टाइम आपने एक बहुत अच्छा पॉइंट बताया इस दौरान, सर्जरी और एचआरटी तो जो करना चाहते हैं वो है, बट एट द सेम टाइम देयर इज प्राइमरी हेल्थ केयर। प्राइमरी हेल्थ केयर जैसे अगर मुझे आज, जैसे आपने कहा, मैं मुंबई से हूँ और आज अगर मुझे हार्ट अटैक आता है, तो which hospital will I be taken to? What is the kind of, are those hospitals, are those medical veterans, are they been sensitized to handle my situation, right? As a trans man, are they going to judge me at the reception? तो ये सारी चीजें हम, so moving to Dr. Aksa Sheikh, right? Because Dr. Aksa, आप ये मेडिकल फेटर्निटी में काफी टाइम से है, और आप, मुझे पता है आपके कुछ इनिशिएटिव्स रहे हैं, काफी इनिशिएटिव्स रहे हैं ऑन ग्लोबल लेवल, वेयर यू स्पीक द नीड फॉर एजुकेशन with the medical staff, where they are sensitized to handle such situations and people from our community. आपको अभी के प्रोग्रेस में, बिकॉज आपने इतना काम किया है, आपको क्या चैलेंजेस फील हो रहे हैं कि अभी भी किस एरिया में, मतलब कुछ ऐसी चीजें भी आप बता सकते हैं जो ऑलरेडी हमने ओवरकम कर ली है, और कुछ ऐसी चीजें जो अभी भी बाकी है, सो प्लीज आपका एक एन आइडिया विजन टुवर्ड्स इट आप शेयर कर सकते हैं, प्लीज।
Thank you, Man, and thank you all the previous speakers for setting the stage for this discussion. Um, मैं भी थोड़ा हिंदी इंग्लिश मिक्स करके बोलूंगी ताकि
थैंक यू,
ऐसे
यस
बोलने से लोगों के दिलों तक बात जल्दी पहुंच जाती है।
जी।
सबसे पहले तो मैं एक अपॉलॉजी ऑफर करना चाहूंगी ऑन बिहाफ ऑफ ऑल द हेल्थ केयर वर्कर्स, टू द ट्रांस पीपल, टू जेंडर डाइवर्स पीपल इन दिस स्पेस, क्योंकि कहीं न कहीं हमारा जो इंटरेक्शन हुआ है विद द हेल्थ केयर पीपल, हेल्थ केयर प्रोवाइडर्स और सिस्टम्स, उसने हमें हर्ट किया है,
जी।
उसने हमें डैमेज किया है, उसने जब हमें मदद की ज़रूरत थी तब नहीं दी है। So first of all, since I also represent the healthcare sector, an apology to all of you for all the harm that we have done to the community. When it comes to healthcare provision, किरण ने बहुत अच्छे से ये बात रखी कि हेल्थ एक बहुत इंपॉर्टेंट एस्पेक्ट है हम सबकी लाइफ का। जिस तरह से हम बात करते हैं रोटी कपड़ा मकान, ये जरूरतें हैं हमारी, उस तरह हेल्थ ऐसी है जो आपके बर्थ से लेके डेथ तक, समटाइम्स बिफोर बर्थ से लेके आफ्टर डेथ तक भी कहीं ना कहीं हमारा हेल्थ केयर सिस्टम के साथ में इंटरेक्शन होता रहता है। एंड देयरफॉर आप चाहो या न चाहो, हेल्थ केयर सिस्टम से इंटरेक्ट करना वो एक मजबूरी भी हो जाती है आपकी, कि आपको जरूरत पड़ेगी और आपको इंटरेक्ट करना ही पड़ेगा। अब ऐसे में एक ऐसा हेल्थ केयर सिस्टम जिसको अगर हम कुछ साल पहले ही चले जाएं, तो वो कहता है कि ट्रांसनेस ये जेंडर आइडेंटिटी डिसऑर्डर है, ये बीमारी है। तो वो डॉक्टर्स, वो नर्सेज, वो हेल्थ केयर प्रोवाइडर्स जो ये पढ़ के आए हैं अपने मेडिकल सिस्टम में कि एक बीमारी है, उनसे हम कैसे एक्सपेक्ट कर सकते हैं कि वो हम बीमार लोगों से सीखें कि हमें कैसे ट्रीट करना चाहिए, है ना? वो बहुत दूर की बात हुई। उसके बाद में अगर हम देखें कि भले ही आप डेफिनेशंस चेंज कर दो, आप नए कानून ले आओ, आप नई गाइडलाइंस ले आओ, उसको प्रैक्टिस में आने में कई साल लग जाते हैं। मैं हमेशा कहती हूँ कि हेल्थ को हम सिर्फ डॉक्टर्स के नजरिए से ना देखें, हम उसको एक स्टेट के लेवल पे भी देखें, बिकॉज भले ही राइट टू हेल्थ ना हो हमारे देश में डायरेक्टली, राइट टू लाइफ है, राइट टू डिग्निटी है, राइट टू प्रोहिबिशन ऑफ डिस्क्रिमिनेशन है ऑन द बेसिस ऑफ सेक्स एंड जेंडर। तो क्या वो राइट हमें मिल पा रहे हैं या नहीं, ये देखना बहुत जरूरी है। अक्सर मैं जब भी किसी फोरम में जाती हूँ और स्पेशली जो गवर्नमेंट रिप्रेजेंटेटिव्स हैं वो हमें कहते हैं हम ये करेंगे, हम वो करेंगे, एंड आई ऑफन आस्क दिस क्वेश्चन, कब? देखिए, नालसा जजमेंट आकर अब 9 साल हो गए, ट्रांस एक्ट आके 4 साल हो गए, रूल्स आके 3 साल हो गए, मतलब हमारी तो जिंदगी खत्म हो जाएगी भाई, आप कब करोगे? राइट। मतलब कई वी हैव सीन जस्ट इन द प्रीवियस लाइफ दैट पीपल हैव लॉस्ट देयर लाइव्स, वो चले गए। अब आप जो करोगे उसका उन्हें कोई फायदा नहीं मिले। सो आई थिंक इट्स आल्सो इम्पोर्टेंट टू डू, बट आल्सो डू इट फास्ट। और जिस चीज का आपने कमिटमेंट कर दिया है, कॉन्स्टिट्यूशनल आपने गारंटी दे दी कि भाई अस्पताल की आपने बात की, तो ट्रांसजेंडर वार्ड होना चाहिए, रूल कहते हैं जी, कहाँ पे है? नहीं है। एक ओपीडी आरएमएल हॉस्पिटल में जो सिर्फ फ्राइडे के दिन 2 घंटे चलेगी, वो बनाकर आप हमें एक लॉलीपॉप थमा रहे हो। राइट। मुझे नहीं लगता कि ये वो है जो आपने कमिट किया। आई एम नॉट सेइंग कि ओवर कमिट, जो कर दिया एटलीस्ट वो तो करो। तो एक बहुत टॉप लेवल से आई थिंक एक जरूरत है कि जो हम राइट्स के लिए कमिटमेंट कर रहे हैं उनको फॉलो अप करना। क्योंकि इफ आई एम वर्किंग इन अ गवर्नमेंट सेक्टर, इफ आई एम अ डॉक्टर, आई एम अ डीन, आई एम अ मेडिकल सुपरिटेंडेंट ओवर देयर, अगर सरकार बोले कि झाड़ू लगाओ, तो हम झाड़ू भी लगाएंगे। लेकिन वो प्रेशर कहीं ना कहीं से आना होगा, एक अकाउंटेबिलिटी सिस्टम में होनी होगी कि आपके अस्पताल में ट्रांसजेंडर वॉशरूम क्यों नहीं है, आपके अस्पताल में ट्रांसजेंडर वार्ड क्यों नहीं है, इसका जवाब हमें कौन दे? दूसरा, अगर हम हेल्थ केयर लेवल प्रोवाइडर्स के लेवल पे जाए, नो आई स्टार्टेड माय मेडिकल स्कूल इन 2000, 23 साल पहले। उससे अगर हम आज देखें 23 साल में बहुत चेंजेस आ गए हैं, ठीक है ना? ये वो अभी जो मेडिकल स्कूल में आ रहे हैं वो 17 इयर्स 18 इयर्स के लोग हैं जो एक अलग किस्म के दौर में पैदा हुए हैं। उन्होंने एक अलग किस्म की फिल्में देखी हैं, एक अलग किस्म के लोगों से इंटरेक्ट किया है, तो नेचुरली उनका पर्सपेक्टिव आई वुड से इज बेटर टुवर्ड्स ट्रांसजेंडर पीपल। बट मुझे लगता है सिर्फ सहानुभूति नहीं चाहिए हमें। आई एम अ वेरी नाइस डॉक्टर, मुझे बहुत अच्छा लगता है ट्रांस लोगों से बात करना, बट मुझे ये नहीं पता कि आपका पैप स्मीयर कैसे करा जाए, तो क्या फायदा? मुझे बहुत दुख होता है ये देख के कि ट्रांस लोग बेचारे बेचारे, बट आई डोंट नो हाउ टू ऑफर मैमोग्राफी। हमारा अस्पताल बहुत अच्छा है, हमने तो जेंडर न्यूट्रल वॉशरूम भी बना दिया, लेकिन सर्जरी नहीं प्रोवाइड करेंगे क्योंकि हमारा डॉक्टर को सिर्फ और काम है। तो इट्स इम्पोर्टेंट कि हमें सिर्फ लोगों के अच्छे शब्द, सहानुभूति और बेचारा ये सब वर्ड्स नहीं चाहिए, वी नीड एक्शन। क्योंकि आज के दौर में ट्रांस लोग किस पे निर्भर हैं? दे आर डिपेंडेंट ऑन अ फ्यू प्लास्टिक सर्जन्स जिनके पास 6 महीने पहले बुकिंग करनी पड़ती है, 5 लाख 10 लाख रुपए का खर्च है। उसके बावजूद भी वो सर्जरी बस्ट अप हो जाए और लोग ऑपरेशन टेबल पे गुजर जाएं, तब भी उनकी कोई अकाउंटेबिलिटी नहीं है। So I think it's very important to look at accountability. It's also important to look at training of the doctors, changing the medical curriculum, एंड वो डॉक्टर्स जो एटलीस्ट थोड़े से एम्पथी रखते हैं, थोड़ा सा एक आपके बारे में अच्छा नजरिया रखते हैं, उन्हें हम किस तरह से हेल्प कर पाए फॉर चेंजिंग दैट। एंड एक और इश्यू जो मुझे लगता है वो ये है कि ट्रांस वीमेन को तो शायद समझ जाते हैं, क्योंकि एक ट्रेडिशनल अंडरस्टैंडिंग है हिजरा की समुदाय की। बट जहाँ तक ट्रांस मेन या नॉन बाइनरी लोगों का सवाल, वहां पे जाके डॉक्टर्स जो है ना वो उन्हें समझ नहीं आता कि ये क्यों वो कर रहे हैं और क्या कर रहे हैं, राइट। एंड ऑल्सो जब हम जनरल हेल्थ केयर की बात करते हैं, आपने कहा आपको हार्ट अटैक हो रहा है, आप जाते हैं आपका ईसीजी करने की जब वो शुरुआत करते हैं देखते हैं कि आपकी चेस्ट में स्कार है। अब उनकी क्यूरियोसिटी वही हो जाती है कि क्या हो गया, कोई हार्ट की सर्जरी हुई थी,
Yes.
है ना, क्या हुआ था, कोई एक्सीडेंट हुआ था, एंड वो आपका हार्ट अटैक वहीं साइड में रह गया।
Yes.
पहले वो ये जानने में ज्यादा है कि ये क्यों किया तुमने,
Right.
ऐसा कौन करता है अपने साथ, नो
Right.
दोस काइंड ऑफ क्वेश्चन। सो इट्स आल्सो इम्पोर्टेंट कि those doctors who want to help, we should enable them to help, and those who are not going to listen, उनके लिए थोड़ा बहुत सिस्टम से भी प्रेशर आने की जरूरत है। एंड वेरी इंपॉर्टेंटली देखिए, आयुष्मान भारत बहुत अच्छा है कि ट्रांस लोग हम 5 लाख रुपए दे रहे हैं, वो लेकर जाएंगे कहाँ?
Exactly. Yes.
वो ऐसा कार्ड है जो एनकैच ही नहीं हो रहा है ना। एंड प्राइमरी हेल्थ केयर की जो आपने बात की, तो
जी।
उसके लिए तो आयुष्मान भारत में प्रोविजन नहीं है।
Exactly.
आप उसमें सेकेंडरी एंड टर्शियरी लेवल का करें, तो आई गो टू पीएचसी हेल्थ एंड वेलनेस सेंटर, और वहाँ के डॉक्टर को तो ट्रांस क्या है ये नहीं पता। So there are a lot of challenges, and I'm sure the family will highlight on that.
Thank you so much, Dr. Aksan. Of course, we will keep connecting to you on this panel. Don't worry. So, Kiran wanted to add something to what you said.
Recently, in Hyderabad Ushmania Hospital, अगस्त थर्ड का 5 ट्रांसप्लांट लोगों को बॉडी स्क्रीन, नया हॉस्पिटल नया पॉलिसी आए, गवर्नमेंट हॉस्पिटल बॉडी स्क्रीन कैसा किया हो, बॉडी स्क्रीन का नया डॉक्टर और वो डॉक्टर ट्रांसप्लांट को फिंगर टेस्ट किया बॉडी को। सो अगस्त थर्ड का हो है, अगस्त 6 का हमको कंप्लेंट है, अगस्त 7 का हम अटैक किया। ट्रांसप्लांट इन वन ऑफ द डॉक्टर Prakshi Rado in Ushmania Hospital, Hyderabad, and she's fight in some in medical report and come finally some policy, but only one transman and transmen finger test क्यों किया? अभी हमको फिंगर टेस्ट करने के जरूरी नहीं है, मैं नहीं बोलिया, बॉडी का पूरा फिंगर टेस्ट का क्यों कर रहे थे? सुपरटेंडेंट के साथ बात किया, सुपरटेंडेंट बोल रहे हैं तो वो जरूरी है, क्या जरूरी है? फिंगर टेस्ट हमारा बॉडी के अंदर तुम्हारा फिंगर क्यों डाल रहे हैं? बोलिए तुमको डाल के, वो 5 ट्रांसमेन हम दूसरा जाके हम बात किया, एडवोकेसी दिया, एचआरटी करने के फिंगर टेस्ट का क्या रिलेशन है? अभी बोलो। तो ये ट्रांसमैन एक कैसा बना है? सारे नहीं आ रहे हैं, एचआरटी ले रहे तो हम देखना पड़ेगा। क्या बात कर रही है?
I think I understand, Kiran, जो आप कहना चाहते हो कि there is no proper guidelines. I'm sure Athi is here and they are trying to work and all the facility is trying to work on creating a place where there is a proper guidelines given to the doctors. Because आज की तारीख में if there is a failure in surgery, as Dr. Aksa mentioned and Kiran mentioned, we do not know who to count accountable. हम कहाँ जाके इस चीज की कंप्लेन करें या किस अथॉरिटी के पास पहुंच के हम बताएं कि ये मेरे साथ हुआ है जो गलत हुआ है, this is not how it's supposed to be happening. There has been some reports which was to make a psychologists or psychiatrists when we are going for the documentation from them or even having counseling sessions with them have reported that there was incidents where the transgender person were asked to take off their clothes for examination. Right? So such critical matter. Imagine the amount of mental health coming to you, my dear
undivided attention is being given to so many causes all going on at the same time. हम सब कुछ एक साथ करने की कोशिश कर रहे हैं, right? Because सब कुछ जरूरी है, but इस सब के पीछे एक मेंटल हेल्थ इतना सब के बाद जब एक इंडिविजुअल के साथ इतना कुछ हो जाता है, मेंटल हेल्थ ही वो रीजन है which put a person in suicidal tendencies. And that includes parents too. You know, even you know that mental health के वजह से where can a parent get access? Where can a family walk up and receive certain guidance when it comes to mental health? So Gautam, I need to understand and we want to know that as okay, what are the things जो हमें mental health concern? What are the changes that the doctors in their approach that has to be there? क्या changes होने चाहिए? एक psychiatrist or psychologist को लेके कि initial stage पे जब a person is trying to understand, they are just there in the phase where they are already lost. They know something is off, but when they're going out for help and they are mistreated, तो आपको क्या लगता है कि क्या गाइडेंस या क्या होना चाहिए एक ट्रांस मैस्कुलिन पर्सन और एनीबॉडी फ्रॉम द ट्रांसजेंडर कम्युनिटी हाउ शुड दे बी ट्रीटेड और इसका आप एक एडवाइस हमें दे सकते हैं these are the changes that over to you Gautam.
Okay, you all here. Okay.
Energy guys, are you all listening? Are you all there? So no mobile checking and nothing happening. No Instagram. Nobody's waiting. Believe me. Okay. So please focus on this. This is really
Okay,
for us.
I
Okay.
can take it over. Thank
Okay.
you.
Gautam is going to take it over. Gautam, take the question.
Okay. Before I answer that question, I want me and you all in this room to acknowledge कि mental health का बात आता है कोई ध्यान नहीं देता है. हमें पता है mental health issues है, हम बहुत प्रोग्रेसिव है, हमें सब पता है, बट अपना ध्यान नहीं रखते हैं. सर्जरी का बात हो रहा था, everybody was so but mental health ठीक है, understand, बट अपना ध्यान भी देना पड़ेगा. So we need to acknowledge first, not by we I mean the larger community, cishet people, कि we as transmasculine person, we were born in a female body or we have this male or masculine identity, तो हमारी दिक्कतें खत्म नहीं हो गई. जो एक नोशन चलता है कि अरे ये तो आदमी है या आदमी बन गया है तो अब क्या दिक्कत है, अब तो जिंदगी जी रहे हो ना तुम. तो पहले तो आप ये एक्नॉलेज करो कि भाई दिक्कतें खत्म नहीं हुई है, उल्टा बढ़ जाती है. अभी कंसील करके चलना पड़ता है. एक तो लॉट ऑफ माय फ्रेंड्स, माय कॉलीग्स आई सी कि नाउ आई हैव टू लिव लाइक अ सिक मैन, तो मैं अपनी दिक्कतें नहीं बता सकता या बताने में हिचकिचाऊँगा. ये तो छोटी-मोटी चीज़ें हैं, तो आदमी आई विल डील विद माय सेल्फ. तो पहले तो वो एक्नॉलेज करना पड़ेगा, वो दिक्कतें हैं और उन पे ध्यान देके हमें भी काम करना पड़ेगा. उसके साथ पैरेलली जो एंटायर हेल्थ केयर हमारा स्ट्रक्चर है इंक्लूडिंग साइकोलॉजिस्ट, साइकियाट्रिस्ट, peer supports, they all will add on to that. And by saying that I don't mean कि onus हमारे ऊपर होना चाहिए. onus तो गवर्नमेंट और हेल्थ केयर स्ट्रक्चर्स के ऊपर ही होना चाहिए. But yeah, to answer your question, what can be done, Aksa was the best person to answer that question, but I will answer by my experience. Uh, is that uh, I have been working with healthcare providers, sensitizing them, training them. One thing I've realized when it comes to training or sensitizing a doctor, you can deliver a training on what's the word, cultural capacity to a doctor. It might be somewhat sufficient to address the larger queer trans community, but when it comes to specifically trans men or entire trans community, you need to help the healthcare providers with uh, technicalities or technical experiences or technical skills, I would say. And that is something which is lacking on a broader scale. जब तक वो gap fill नहीं होगा, I mean, we have AXA, we have other healthcare providers who are as friendly as any person could be to us. they can talk to us in a better way. They can help us. They can advise us. They can, as they mentioned कि अगर मुझे ECG कराना होगा या मुझे अल्ट्रासाउंड कराना हो जाएगा तो वो कैसे डील करेंगे या उनके साथ में जो काम करते हैं नर्सेस हो गया वो कैसे डील करेंगे इन चीज़ों को? क्या वो मुझे उतना कंफर्टेबल फ़ील करा पाएँगे? आउट ऑफ क्यूरियोसिटी वो क्वेश्चन पूछ रहे हैं बट मैं कितना अनकंफर्टेबल फ़ील कर रहा हूँ कि मैं दोबारा जाना नहीं पसंद करूँगा एंड दैट हैपेंड विद मी. So I feel that's the first step, and Athi and Aksa, they all people are working on upgrading or enhancing the medical curriculum. But वो तो अभी जो क्वेयर मेडिकोस हैं या स्टूडेंट्स हैं वो पढ़ रहे हैं आज से 5-6 साल बाद वो आएँगे तब तक हमको ज़रूरत पड़ेगा तो हम कहाँ जाएँगे? तो I feel the best structure is can be imposed or helped by government sector. You have to put on the laws. हमारे ट्रांस एक्ट में है वो 6 साल से 6 महीने से 2 साल का प्रोविज़न सज़ा का। बट वो कितना ही कारगर है या कोई कैसे ही उसको लेकर के कंप्लेन रेज़ कर सकता है। इट्स देयर इज़ नो प्रूफ या फिर कभी नहीं देखा कि कोई कंप्लेन रेज़ कर रहा है और ट्रांस एक्ट के अंदर किसी को सज़ा मिल रही है। तो बहुत दूर की बात है कोई डॉक्टर के खिलाफ कंप्लेन रेज़ करेगा और ज़रूरत ही क्यों पड़ रही है? आप डॉक्टर हो, हमें नीड है, हम आपके पास आ रहे हैं। So that's first thing. Another I feel अ, कि जो हमारा इनबिल्ट स्ट्रक्चर है कम्युनिटी के अंदर ही, द पीयर्स वी हैव हमारे खुद के एक्सपीरियंसेस हैं। हमें वो स्ट्रक्चर्स एनहांस करने की ज़रूरत है जो एक्सिस्टिंग है हमारी कम्युनिटी के अंदर। हम एक-दूसरे को हेल्प कर सकते हैं और आई थिंक करते भी हैं। आपको भी कॉल आते होंगे, मुझे भी कॉल आते हैं कि मुझे रिलेशनशिप का प्रॉब्लम है, बता दीजिए या मुझे सर्जरी कराना है। These these things already exist in the community. What we as organizations or community leaders can do is enhance those existing structures ताकि हम और लोगों को सपोर्ट प्रोवाइड कर सकते हैं। हर बार आपको ज़रूरी नहीं है कि आप साइकियाट्रिस्ट के पास जाओ, साइकोलॉजिस्ट के पास जाओ। आप आपस में भी हेल्प ले सकते हो। एंड फॉर दैट we need to unite and understand each other. I think that we have enough in the Transmet community.
Yeah, we
to
have
probably
that.
say that.
Yeah, I think even I will reach out to Gautam if I need any relationship or advice.
I am
Frankly.
not an expert in that. I'm sorry.
We need a relation. Okay, I'm using this platform to let you all know that we all mostly 80%, not a data, but we all are looking for a partner. Definitely, please, if somebody is listening, create an app. A dating app is an authentic one is required here. But thank you so much, Gautam, because what you really said is we peers, as you know, I know you're also working on an initiative to have more peer groups, which is excellent. We need to be there for one another. Like most of us are missing out on a family or a sibling or a friend, and at this point, I think the community should be more towards together, right? Because that's one thing definitely will take us long way, right?
I
So
one more thing. I'm sorry. Just
yes, yes,
2
no problem.
minutes. Uh, जगह मिलता नहीं है ना बोलने के लिए।
हाँ, यही देना चाहते हैं। Okay.
तो आई वाज़ टॉकिंग अबाउट हेल्थ केयर प्रोवाइडर्स। एक तो मेंटल हेल्थ इश्यूज़ हैं हमारे लाइफ के होते हैं, रिलेशनशिप्स के हो गए, फैमिली के हो गए, ये हमारा इन सब पे ध्यान जाता है। एक और तरह के मेंटल हेल्थ इश्यूज़ है जिस पे लोगों का ध्यान नहीं जाता है, क्योंकि हमें अपनी ज़िंदगी को अपना बनाने की बहुत जल्दी होती है, आई अंडरस्टैंड दैट। कोई आपको खाते रहता है और करियर भी आप उतने तरह से अच्छे से सेट नहीं कर पाते इफ यू वांट टू गो फॉर सर्जरीज़ और एचआरटी। सो अ, आई एम श्योर मैंने भी ध्यान दिया था, आप लोगों ने भी ध्यान दिया होगा जब आपने हार्मोन्स लेने स्टार्ट करे, देयर वर few differences or some changes apart from your physical but also emotional health. So there have been uh, लोगों ने ऐसा बोला है कि मुझे डिप्रेशन बहुत हो गया, मुझे एंग्जायटी बहुत होने लग गई। तो आई फील ये उस साइकियाट्रिस्ट को बताने का ज़रूरत होता है आपको और आपको खुद को भी एजुकेट करना होता है। बट आई वुड लाइक टू रिइटरेट कि यहाँ पर साइकियाट्रिस्ट का काम भी होता है जब आप OGD लेटर ऑफर कर रहे हैं या बना रहे हैं आपका, वो आपको बताएँ, आप ये प्रोसीजर से जाओगे, इसके ये हेल्थ इम्प्लिकेशंस होंगे, फिजिकल हेल्थ केयर इम्प्लिकेशंस एंड मेंटल। आपको ध्यान देना होगा और आपको व्हाटएवर इज नीडेड, इवन आपको थेरेपी की जरूरत है तो आप वो भी लो। और कई बार ऐसे भी सुनता हूँ लोगों से कि मैंने अपना टॉप सर्जरी कराया, बॉटम सर्जरी कराया, उसके बाद वो क्या बोलते हैं डिप्रेसिव फेज आता है। तो लोगों को इस बारे में पता ही नहीं है, क्योंकि आप ये काम होता है, आप किसी भी छोटी-मोटी सर्जरी के लिए भी जाओगे तो आपका डॉक्टर बताता है कि आपको पॉटी नहीं आएगा या एंग्जायटी होगी, ये सब बताते हैं। बट मुझे मेरा हार्मोन स्टार्ट करने के पहले सिर्फ इतना बताया था दाने आएँगे, बाल झड़ेंगे। ये तो पता ही नहीं था कि भाई डिप्रेशन, एंग्जायटी भी होगा, तो मैं उसका भी ध्यान रखता, और ना ही सर्जरी के टाइम पे बताया। आई फील कि डॉक्टर्स डू नीड टू टेक दैट ओनस टू impart that knowledge they have.
Ji, ji.
Yeah.
I agree. I think Gautam very well said because 2000. I think Aksar we are almost same age, but जब 2007 में I went for gender identity disorder कहा जाता था, and I went for my psychiatrist. I literally had to go through 2 years of psychiatric treatment. Okay, I was sitting with Down syndrome kids in the room, giving my examination, trying to आज एक्सेस थोड़ा इजी हो गया है तो 1500 जीपे करके हमें जेडीज मिल रहे हैं व्हिच इज आल्सो समथिंग दैट यू ऑल नीड टू कंसीडर बिकॉज़ इट्स इवेंचुअली मेंटल हेल्थ पे आपको जेडी तो मिल गया आपको सुकून मिल गया बट इफ यू नीड एन एक्सेस ओवर एंड अबव प्लीज मेक श्योर के कुछ जैसे रेनबो पेरेंट्स है या कुछ कम्युनिटी मेंबर्स है रीड फाउंडेशन है रीच आउट टू देम एंड आस्क देम कि भाई हम कहाँ से हमारी थेरेपी सेशंस भी ले जाए right? It's do not stop there because you got your GD in hand, right? And the most important question here, because we have been facing this in the healthcare, भले जैसे किरण ने कहा और अक्सा ने कहा हमें प्राइमरी हेल्थ केयर मिल जाए, सर्जरीज मिल जाए, मेंटल हेल्थ केयर मिल जाए, पेरेंट सपोर्ट मिल जाए, ये सब लेके अभी जब हमें लीगल डॉक्यूमेंटेशन कराना है, ठीक है, where we want to finally go ahead and go for the legal documentation. What are the challenges Nikunj that gender identity documentations में एक बंदा हर कुछ बोलते हैं ना पहाड़ क्रॉस करके पहुंच चुका है but what are the things जो अभी भी जेंडर आइडेंटिटी डॉक्यूमेंट्स चेंज कराने में हेल्थ केयर के वजह से एक दुविधा हो रही है right?
थैंक यू सो मच मन।
Thank
आवाज आ रही है? तो नहीं आ रही मेरी आवाज?
you. आ रही जोश yes.
हेलो। फर्स्ट ऑफ ऑल यहाँ पर इंग्लिश कितने लोगों को नहीं आती है? हिंदी हिंदी समझ किसको नहीं आता है यहाँ पे? सबको आता है। थैंक यू मेरे लिए आसान होगा हिंदी में बात करना, या तो फिर मुझे ट्रांसलेट की जरूरत होती इंग्लिश वालों के लिए, क्योंकि मैं माइनॉरिटी पे ज्यादा ध्यान देता हूँ। तो एक बार मुझे आप हिंदी में
जी जरूर ऑफ कोर्स
डॉक्यूमेंट्स
सो अभी जैसे हम एक ट्रांस मैस्कुलिन है जिन्होंने अपनी सर्जरीज करा दी या मेंटल हेल्थ ट्रीटमेंट चालू है फैमिली का सपोर्ट है पर आखिर में जब बात आती है लीगली वो सारे हेल्थ डॉक्यूमेंट्स लेके जाने के बाद जब उनको लीगली वो ट्रांजिशन बिकॉज हर कोई फिर चाहे एजुकेशन के लिए हो या जॉब लेनी है तो हर कोई एक डॉक्यूमेंट प्रूफ मांगता है राइट और वो लीगल डॉक्यूमेंट में आज भी बिकॉज हमने सर्वे किया है जो जिन्होंने यहाँ पे सर्वे हुआ है आज की तारीख में भी पॉलिसीज होने के बावजूद पोर्टल होने के बावजूद लीगल डॉक्यूमेंटेशन चेंज नहीं हो पा रहे तो यहाँ पे अगर आप बता सकते हैं कि ये क्यों हो रहा है हेल्थ केयर कहाँ अफेक्ट हो रही है इस चीज में मतलब सब कुछ करने के बावजूद यही प्रॉब्लम है
सबसे पहले मैं बताना चाहूंगा कि एक्ट को लेकर, एक्ट का जो ट्रांसलेटर है, जो हिंदी से इंग्लिश किया हुआ है, इंग्लिश से हिंदी किया हुआ है, वो काफी अलग-अलग भाषा में ट्रांसलेट हो पा रहा है ना। जैसे कि इंग्लिश में लिखा हुआ है मेडिकल इंटरवेंशन, हिंदी में उसको सर्जरी सर्टिफिकेट लिख दिया है। तो हमारे स्टेक होल्डर तो यही बोलते हैं कि हम तो डॉक्टर नहीं हैं, हमें तो इस टाइप का एक सर्टिफिकेट लाके आप दे दो और
राइट
सर्जरी का ही दे दो। बट उन्हें पता ही नहीं है कि मेडिकल इंटरवेंशन में हार्मोन्स भी है। हम उन्हें नेशनल ट्रांसजेंडर पोर्टल जो है उसके अंदर एफएक्यू क्वेश्चन है। उसके अंदर भी लिखा हुआ है कि लेज़र थेरेपी हो गया है या आपका जीडी हो गया है, तो उससे भी आपका बाइनरी सर्टिफ़िकेट बन जाएगा। उससे पहले दिक्कत यही आ जाती है कि लोगों को पता ही नहीं कि ट्रांसमस्कुलिन प्यूपिल भी ट्रांस पर्सन में ही आता है।
राइट।
तो हम जब जाते हैं टीसी कार्ड अप्लाई करने के लिए तो सबसे पहले हमारे सामने यही क्वेश्चन होता है कि तुम्हें क्या ज़रूरत है? तुम तो ट्रांसजेंडर हो ही नहीं।
हाँ।
क्योंकि उन्हें पता ही नहीं है ना कि ट्रांसजेंडर की डेफिनेशन ट्रांस एक्ट में क्या है।
जी।
फिर उसके बाद जब हम उन लोगों को बताते हैं कि सर देख ही लीजिए कि अब आप एक्ट में देख लीजिए या आप क्रोम कर लीजिए क्योंकि अब तो उसमें भी आने लगा है ट्रांसजेंडर की परिभाषा।
जी।
तब जाके हम उनसे बात करते हैं तब 6 का बन जाता है। सेक्शन के लिए जिसको बाइनरी सर्टिफ़िकेट चाहिए, उसके लिए फिर वही दिक्कत आ जाती है सर्जरीज़ को लेके। अच्छा, आपकी तो सर्जरी अभी पूरी हुई नहीं, आपकी बॉटम सर्जरी और सारी सर्जरी हो जाएगी फिर हम आपको मेल कंसीडर करेंगे, उससे पहले नहीं करेंगे। क्योंकि आपने फिर किसी से गलती से शादी मतलब धोखा देके शादी कर ली तो? तो वो क्या दिक्कत आ रही है क्योंकि उनको ना जेंडर और सेक्सुअलिटी को लेके अवेयर ही नहीं है, पता ही नहीं है क्या है ये। उसके बाद ठीक है, लड़ झगड़ के बनवा लिया आखिर 2 साल की मेहनत लगी इसको बनाने में, बट इसमें हमारा समय निकलता जा रहा है। आज मेरी एज इतनी हो गई है कि मैं बहुत सारी गवर्नमेंट जो एग्ज़ाम है वो क्रैक नहीं कर पाता हूँ। जो मेरा सपना है, जो मेरी डिग्निटी है या मेरे जो राइट्स है, वो मैं नहीं ले पा रहा हूँ।
राइट। हुँ।
तो एक एक तो ये एंटाइटलमेंट को लेके काफ़ी दिक्कत है। दूसरा जैसे कि फिर आ जाता है कि टीजी कार्ड तो बन चुका है, बनवा लिया हमने काफ़ी मशक्कत के बाद। उसके बाद आता है आधार कार्ड, पैन कार्ड हो गया है या हमारे मार्कशीट ये हो गया है।
सो निकुंज आपको लगता है कि अगर ये सबको हम एक सेंट्रलाइज़्ड पोर्टल पे लाके रखें, जहाँ पे
हाँ, मैं
डॉक्टर्स हाँ,
उसी
या
पे ही आ रहा था
यस।
कि मतलब क्या है कि आज चाहे वो गाँव हो या कहीं पे भी मोबाइल सबके पास होता है।
जी।
इंस्टा, रील्स सब चलाना आता है, सबको एक्सेस करना आता है।
जी।
तो हम चाहेंगे कि एक ऐसा सिस्टम क्रिएट किया जाए,
हुँ।
जो समझ आ सके चाहे वो रूरल एरिया का हो, जो पढ़ा-लिखा हुआ नहीं हो, उसके अंदर थोड़ा लैंग्वेज को लेके भी बात हो। ऐसा सिस्टम ऐसा बनाना पड़ेगा ईज़िली ताकि उसे हर कोई एक्सेस कर सके।
जी।
चाहे वो ट्रांस पर्सन्स भी हो क्योंकि अभी आप बात नहीं मानोगे मेरे मोबाइल के अंदर 3 दिन मैंने व्हाट्सएप नहीं खोला, मेरे पास 10,000 मैसेजेस रखे हुए हैं, इंडिविजुअल। तो मैं अब अकेला तो उसका नहीं दे पाऊँगा ना एक्सेस। तो मतलब ऐसा कुछ चीज़ हो जाए या हम उसको ग्रुप में सर्कुलेट कर दें ताकि वो वहाँ से देख ले कि बार-बार उनको पूछना ना पड़े, किसी भी चीज़ के लिए कि अच्छा टीजी कार्ड के लिए हम कहाँ जाएँ? मेंटल हेल्थ के लिए सर्जरी के लिए हमें कौन से डॉक्टर के पास जाना चाहिए?
जी।
या कहाँ पर हम एक्सेस ले सकते हैं? क्या हमारे लोकल एरिया में है? क्योंकि अब इंदौर में जैसे मध्य प्रदेश में भी सर्जरीज़ और ये स्टार्ट हो गई है, बट उनको बाहर जाना पड़ता है करवाने के लिए क्योंकि उनको पता ही नहीं है। हम भी इतना रीच आउट नहीं हो उनके पास नहीं जा पा रहे हैं क्योंकि रिसोर्स नहीं है हम लोगों के पास।
जी।
तो वही है कि एक इस टाइप से कुछ पोर्टल या ऐसा कुछ मिल जाए सिस्टम, जहाँ पे हर लोग उसको रीच
एक्चुअली
आउट कर
निकुंज
सके।
आई एग्री और थैंक यू सो मच बिकॉज़ आई थिंक ये एक कोशिश अगर सब करें तो फिर चाहे प्राइमरी हेल्थ केयर हो, मेंटल हेल्थ केयर हो, हमें अभी हमारे अगर मेरी एरिया में भी कोई सेंसिटाइज्ड हो तो भी मुझे पता नहीं है आज की तारीख में और ना ही लीगल डॉक्यूमेंट्स को चेंज करने वाला जो एक प्रोसेस होना चाहिए टू कट डाउन ऑन द टाइम we because transmasculine होना या transgender हो they are already going through a lot ऑलरेडी उनके लाइफ में ऑलरेडी चैलेंजेस है और अभी फिर लीगल डॉक्यूमेंट्स को लेके सो बिफोर वी कैन रैप अप दिस पैनल डिस्कशन आई वांट टू ओपन अप टू एवरीबॉडी आउट हियर अगर कोई है यहाँ पे जो एक स्पेसिफिक कंसर्न लेके बात करना चाहता है ट्रांस मैस्कुलिन हेल्थ केयर को लेके जहाँ पे हम uh, ये सारे इनपुट्स के बावजूद भी हम और कुछ ऐड करना चाहे जो आपकी स्पेसिफिक रीजंस की वजह से आप यहाँ पे हो तो प्लीज रेज योर हैंड्स अपना हाथ ऊपर कीजिए ओके दैट ओके Okay, so two questions we'll take from there. Dono blue t-shirts, amazing looking. So three? Okay, three. So sorry. Yeah, so yes, tell me.
सबसे पहले गुड आफ्टरनून ऑल।
Good.
आ रहा है ना?
जी जी।
एक्चुअली मेरा नाम रणवीर सिंह है। आई एम
Okay.
फ्रॉम सूरत और मैं लक्ष्य ट्रस्ट की तरफ से आया हूँ। और मेरा जो क्वेश्चन है वो ये है कि मैं चाहता हूँ कि ट्रांस मेन अपनी सर्जरी के लिए जो डॉक्टर का सिलेक्शन करते हैं उसको बहुत सोच समझ के करे, क्योंकि मेरे साथ जो हादसा हुआ है वो मैं नहीं चाहता कि इंडिया के किसी भी ट्रांसमैन के साथ हो। मैंने डॉक्टर सिलेक्ट किए थे डॉक्टर सुमित जायसवाल, जैनित प्लास्टिक सर्जरी, इंदौर, जिन्होंने मेरी बॉडी के ऊपर न्यू एक्सपेरिमेंट करा और वो एक्सपेरिमेंट फेल हो गया। इसके वजह से मेरे बॉडी में 52 स्टिच लिए गए जिसमें पस बन गया था और मैं 12 दिन तक तो एक आईसीयू में रहा था। 6 महीने के अंदर मेरी 3 बार सर्जरी हुई, 2.5 लाख रुपया लग गया और मेरी सर्जरी पूरी तरह से फेल हो गई और मेरी सर्जरी पे कोई एक्शन नहीं लिया गया, किसी भी प्रकार का मुझे सपोर्ट नहीं मिला। ये तो मेरा थोड़ा-सा पहचान अच्छी थी कि मेरे सिस्टर करनी सेना की अध्यक्ष है ग्वालियर में और कुछ अच्छी पहचान होने की वजह से और राधिका राज गायकवाड़ की संस्था से जुड़े हुए होने की वजह से मुझे सपोर्ट अच्छा मिल गया। लेकिन हर व्यक्ति इस लेवल पे नहीं होता। आज मेरी बॉडी पे एक्सपेरिमेंट हुआ है, कल को उठ के ये डॉक्टर लोग किसी और पर्सन की बॉडी पे न्यू एक्सपेरिमेंट करेंगे तो हमारी बॉडी एक जीता जाता हमारा ड्रीम है। वो किसी के एक्सपेरिमेंट के लिए पोस्टमार्टम वाली बॉडी नहीं है कि जिस पे आप रिसर्च करके कुछ नया सीख सको। तो मैं चाहता हूं कि ये चीज नहीं होनी चाहिए और आयुष्मान कार्ड के थ्रू गवर्नमेंट ऑफ इंडिया जो सर्जरी के लिए डॉक्टर हायर करते हैं उनको चाहो तो विदेश से कोई एक्सपर्ट डॉक्टर की टीम के थ्रू उनको ट्रेनिंग दिया जाए और उसके बाद उस डॉक्टर को हायर किया जाए कि हाँ ये हमारी बॉडी का ऑपरेशन करने के लायक डॉक्टर है। क्योंकि हमारी बॉडी को मजाक नहीं है, ये वो बॉडी है जिसके लिए हम बचपन से सपना देख रहे हैं। हमारा डॉक्टर लोग के लिए एक सर्जरी है, हो गई कंप्लीट भाई, दूसरे को आने दो, अभी दूसरे की ऑपरेशन है, कल तीसरे का डिस्चार्ज है। ये तुम्हारे लिए सर्जरी है लेकिन हमारे लिए तो ये हमारी जिंदगी का सपना है यार, जिसके लिए हम जी रहे हैं। तो मैं चाहता हूं कि डॉक्टर का सिलेक्शन मेरे हर एक भाई 1000 बार सोच समझ के 10 लोगों की सलाह लेकर 10 लोगों के रिजल्ट देखकर डॉक्टर का लेवल देखकर उसके भी प्रैक्टिकल रिजल्ट देखकर उसके बाद डिसाइड करे कि हमारे लिए कौन सा डॉक्टर लायक है जो हमें नया जीवन दे सकता है।
थैंक यू, थैंक यू, थैंक यू।
Thank you
because ये
so much,
बहुत
everyone.
बड़ा करेज लगता है कि आप 4 लोगों के बीच पहले तो अपनी पर्सनल लाइफ इतने ओपनली बात करें और आई एम सॉरी दैट you went through this and I know there are few fellow people that I have personally also come across जिनके साथ ऐसे कुछ life threatening incidents हुए हैं। So I'm glad because I'm very glad that ये वीडियो अभी लाइव स्ट्रीमिंग है और अगर यहाँ पे कुछ ऑफिशियल सब नहीं है अवेलेबल because of their routine, they can go to YouTube and play this today's session seminar and understand कि कहाँ कहाँ चेंजेस होने जा रहे हैं, कहाँ होने चाहिए ये चीजें लेके। And thank you so much, my dear, and I'm so sorry that you went through this.
Thank you so
But
much, sir.
thank you for opening up, and we will definitely जो आप बोल रहे हैं वो बहुत जरूरी है। We need global level of surgeons to come to India and have give their practice and understanding to Indian doctors. So I agree. Yes, thank you.
Thank you so much,
Next
everyone.
question.
Thank you so much.
रणवीर के इससे एक आइडिया आया है कि हम इंडिया में हम एक इस टाइप से सिस्टम बना सकते हैं कि अगर किसी डॉक्टर के कारण अगर कुछ होता है तो हम उनकी शिकायत करें कहाँ?
Right.
क्योंकि वो कंसर्न तो पहले ही ले लेते हैं।
आई थिंक जो पोर्टल की आइडिया आपने निकुंज दी है ना, दैट इज वन प्लेस जहाँ पे मतलब अभी इतने सारे वेबसाइट्स हो गए हैं कि सबको फॉलो करने हर किसी पे अलग इंफॉर्मेशन से अच्छा अगर एक पोर्टल है और जहाँ पे वी कैन रेज अ कंप्लेन
टुवर्ड्स अ सर्टेन डॉक्टर, ताकि हम तो हर बंदे के पास जाके नहीं बोल सकते अपना पर्सनल रिव्यू, पर अगर हमें एक पोर्टल दिया जाए जहां हम पर्सनली डॉक्टर्स का रिव्यू डाल दे सके, एटलीस्ट वी विल सेव people's life by letting them know that it's not a holistic place. ये डॉक्टर तुम्हें अगर कुछ भी आश्वासन दे रहा है तो उसको blindly follow ना करे. Next question. Thank you, Nikhil. Yes, you wanted to ask a question. You, yes, please.
Hello. Hello, everybody. My name is Kiran Raj from Telangana. Uh, I'm acting as a state coordinator for transgender persons help desk in Telangana government. तो मुझे चांस देने के लिए बहुत बहुत धन्यवाद सबको। तो यहाँ पे आप सबको मैं अपनी ही मतलब एक सिचुएशन बताना चाहता हूँ, तो जो मैंने अपनी ज़िंदगी में गुज़रा है। मैं एक बायोलॉजिकल चाइल्ड का मदर हूँ एक्चुअली। अ, मैं अपनी ज़िंदगी में फ़ोर्स मैरिज का विक्टिम भी हूँ, तो उसकी वजह से मेरा एक चाइल्ड भी है। अभी वो 22 साल का अ, बच्चा है अभी मेरा मेरा। तो अब यहाँ पे एक ट्रांस मैन का मतलब मदर यहाँ पे आई हुई हैं, उनका सपोर्ट देखकर मतलब मुझे बहुत अच्छा लगा, अपने बच्चे को समझने का अंदाज़ बहुत अच्छा लगा। तो मुझे आप सबको एक याद दिलाना चाहता था मैं कि अब एक तरफ से बच्चे मतलब एक ट्रांस बच्चा होना कितना मुश्किल है, ये समझने के लिए थोड़ा-थोड़ा सब लोग सोच रहे हैं। एक बच्चा जो है वो एक ट्रांस अ, मैन का बच्चा है। मेरा बच्चा ट्रांस मैन का बच्चा है। उसको कैसे ज़िंदगी मतलब ज़िंदगी में कितने सारे अ, इश्यूज़ आते होंगे, कितना उसको ट्रॉमा होता होगा। उसकी माँ जो है, माँ जैसा नहीं दिखती। स्कूल में मतलब उसको सबको सबको अपनी माँ को पहचान मतलब माँ को लेके जाके दिखाना चाहता है, मगर उसकी माँ जैसा नहीं, उसको कितना मतलब मुश्किल होता होगा एक बार सोचिए। तो मैंने अपनी ज़िंदगी में अपने बेटे के साथ कभी भी उसके स्कूल फंक्शन में या स्कूल पेरेंट्स मीटिंग में अटेंड नहीं किया। उसके साथ कितना मैंने मतलब क्या हुआ होगा उसके बचपन में एक बार सोचिए। कितना उसका दर्दनाक बचपना है, बचपन कैसे गुज़रा है। वो भी मैं ट्रांस मैन होके मैं खुद के लिए ट्रॉमा में डिप्रेशन में रहता हूँ और अब मैंने अपने बच्चे को भी इतना भयानक चाइल्डहुड दिया है। तो फिर भी उसके बावजूद मेरा बच्चा मुझे सपोर्ट करता है।
Very
मेरे
nice.
सर्जरी के टाइम पे
Very nice.
उसने खुद सर्जरी के मतलब कंसेंट फॉर्म में साइन करके मेरी सर्जरी उसने करवाई है। तो ऐसे लोगों को भी उनके बारे में भी जानना बहुत ज़रूरी है और अभी भी बहुत सारे ऐसे इश्यूज़ हैं कि अभी मेरे बच्चे का एलएलबी का अभी कोर्स चल रहा है, तो वहाँ पे उसको स्कॉलरशिप के लिए जा रहा है तो अ, वैसे ही तो आप मतलब मेरा डाइवोर्स हो गया था मेरे हस्बैंड के साथ, तो अभी उसके साथ उसके पिता नहीं आ सकते कभी जाने के लिए मगर हम लोग मेरे पास रहता है बच्चा तो
Right.
अब रेशन कार्ड में भी अब मैं अगर नाम चेंज करना चाहूँगा, तो मेरे बच्चे को प्रॉब्लम हो जाएगी। इसीलिए रेशन कार्ड में नहीं मेरे को समझ में नहीं आ रहा
I'm
मैं क्या
sorry, we
करूँ?
want to hear you more, but
हाँ।
thank you so much. I'm sorry, time constraint की वजह से, but let me tell you one thing. जो आपने बोला है वो बहुत बहुत बड़ी धार्स की बात है और इसके लिए because being a trans person and this journey, because ऐसे हम सोचते हैं कि ये बहुत easy रहेगा. I'm definitely hats off to you that you have even stood up to discuss this. But ये चीजें है. We are a modern world. कब तक कल्चर के पीछे, एज गैप, रिलीजन, कास्ट के पीछे, there are so many things that a person, a trans kid, is forced to wear or dress up or get married and do things outside who they are. ये मेंटल हेल्थ का जो कंसर्न है इस सबको प्लीज कंसिडर किया जाए for everybody who are the policy makers. And right now there is Vihan. Do you have that question? Can you? Yeah, next to you. You have a question, right? You're done? Okay, great. So once again, thank you so much everyone for this panel discussion. I know कि यहाँ पे हर जो बंदा है उसकी अपनी एक story है, उसकी अपनी कहानी है, and it is hats off to everybody who make this happen today, Jaden and his team for being here and contributing to the study, and to all the sponsors and people from UNDP and who will be that we trust, we put our trust and rely that they will on the current study. We look forward for it, and the sooner the better, so that we can save more lives in the progress. So thank you once again. A big round of applause to all the panelists out here for giving out their time and information and knowledge, which is going to contribute to us. So thank you so much.
Yes, thank you so much, everyone, and thank you so much for all the wonderful panelists and amazing moderator. So now I want to request Aidan to facilitate Dr. Asika Sheikh.
Hello, energy once again, please, to Dr. Aksa Sheikh.
Thank you, Aidan. Now I request Aidan to facilitate Gautam.
यार लंच है इसके बाद प्लीज तालियां थोड़ी होनी चाहिए.
I also want to request Aidan to facilitate Kiran. Thank you, Aidan. Now I want to request Dr. Chiranjeev ji to facilitate Nikunj. I also request Dr. Chiranjeev ji to facilitate Man. Thank you, Chiranjeev. I also want to request you to facilitate Mona ji. Thank you, everyone, for being here so patiently, being with us since morning. Right now, we are going to break for lunch, but after lunch, there will be few topic sessions, discussions we are going to do, but it is mostly for transmasculine persons. If our allies and people who are other stakeholders who want to join us, they can definitely join us as a observer, but it is mostly for transmasculine person space. I really want to thank everyone from bottom of our heart of OHM team to be here, to just listen to all of us, be here and provide a safe space and allow us to do some of the mistakes which we usually do. Thank you everyone for here. I want to request everyone that we will be breaking for lunch only for 1 hour. So please come back on time. We want to continue with